treatment modalities mentioned in Ayurveda with respect to the management of Sandhivat, that is knee osteoarthritis. But this particular webinar will be focused on successful management of knee osteoarthritis.
Good afternoon, everyone. I welcome you all. We'll just start the webinar in the next 10 minutes. We are just waiting for everyone to join. I would request if you all can communicate to all your networks and connections so that everybody are able to join the webinar. I hope everyone can hear us. If you can hear us, just say hi, just say good afternoon. I hope you all can hear us, listen to us, our voice is audible. I'm also sharing the Zoom link, direct Zoom link to join. Anybody who can directly wants to join, they can also join. This is the Zoom link I've shared over the chat.
Rishabh, can you please share the YouTube link?
Yeah, just a second, I'll share that. Good afternoon, everyone. I can see that people are still joining. I would really appreciate everyone to please share this link with all your networks, with all your friends and family, and they can directly join the webinar with the link that I've shared over the chat. We are just about to start the webinar in the next 10 minutes. And I assure you that this webinar will gonna be a most impactful webinar. A lot of learnings, insights, case studies will be shared in this webinar. It's a fantastic webinar will be happening today. So I will suggest nobody should miss this out. And I would like to share this with you all that there is no passcode required to join the webinar. You just have to click the link, which I'm sharing over the chat right now. And I've sent over the Telegram group and the WhatsApp group as well. And I hear a lot of queries are coming that this webinar will be shared, the recorded webinar will be shared. Yes, we will share the recorded webinar with you all. But I would really suggest that if you can, if you attend the webinar for the entire session, it will be helpful for you all to ask relevant questions and get your doubts also clarified. In the next 5 minutes, we're going to start the webinar. Uh, Everyone, by the meantime, everybody joins. Just going to launch a short poll where I just want to know that we have arranged a webinar last month also, and I just want to understand that who all are new visitors and who attended the last webinars. It's just a short poll. I'm just sharing it over your screen. You just have to do a simple poll. That's great. I'm so happy to hear that a lot of people are coming for the first time, and a lot of people are returning, are also coming to attend the webinar again. Uh, Really nice to see.
So, friends, if you have any questions or any doubts regarding the management of osteoarthritis, you may please put your questions in the Q&A section, wherein we would try to the best of ability to get it answered by Dr. Satya sir. Whatever your doubts, questions, you can please write in the Q&A session.
Doctor, can we start or shall we wait for some more time?
Let's wait for another 3 minutes.
Okay. Then let's start at 15:15, 6 minutes.
Sure. Dear friends, as always, there would be gifts and great bumper prizes, and we would select the winners on basis of their active participation, on basis of the questions they are putting, on basis of their role in the webinar. There would be great gift hampers and holiday resort package that I think Rishabh will brief you shortly. Rishabh,
Yes, doctor.
can you please brief about the prizes and gifts?
So I hope everybody is aware that whoever have registered for this event, they will be getting an assured gift voucher of 1,000 rupees. So once this webinar is over, we will be sharing the coupon codes and voucher codes with you so that you can redeem it in the website of Kairali products. And whoever, we will be giving out the prizes for our luxury retreat, which is in Palakkad, Kerala, and for 3 nights, 4 days. And whoever asks the best question and works out to be a best question, so we will be awarding them. Top 3 winners, we will be getting the gift voucher of Ayurvedic Healing Village, which is worth rupees around 90,000 rupees. So I wish you all the best. So stay attentive. You can you can post all your questions. Our panelist, Dr. Sachin, and the keynote speaker, Dr. Satya, will be judging the best question, and we will be announcing the winner at the end of the webinar. So stay till the end of the webinar. I would like to share with you all the webinar ID is 885-7703-9933. You can also directly join with this webinar ID. I'm sharing over the group as well, over the chat as well. This is the Zoom ID. You can join directly to this webinar. No passcode is required. You don't need any passcode to join this webinar. You just have to log in with this Zoom ID. I would request and suggest everyone to please post any questions, any doubts, any questions you have in mind regarding the topic. Please post it in the Q&A section. Please don't post it over the chat box. It will help us to collate all the questions and answer them properly. There is a Q&A box on your screen. You can just click on that and post your questions. I'm so happy to see that everybody has started posting questions. I'm so delighted to see the participation by you all. Dr. Sachin, we can start the webinar. It's 3:15 right now.
Yeah, sure. Let's start the webinar now.
I'll just start with a short introduction.
Sure.
Shall we start, Doctor?
Yeah, please start.
Because I believe a couple of people are more joining in, but it's 3:15 already. So let's start the webinar, and parallelly people can start joining in. Okay, Doctor?
Yeah,
Yeah,
go ahead.
Yeah. So namaste, everyone. Namaste, doctors. I warmly welcome you all to this virtual CME in Ayurveda organized by Kairali Ayurvedic Group. Allow me to introduce myself. I'm Rishabh Gupta, Vice President Marketing for Kairali Ayurvedic Group. And I'm so delighted to see the participation level from you all. And this is the another webinar, second webinar that we have organized. Last webinar was also one of the most successful webinar. So this webinar is also one of the most exciting webinars and most insightful webinar. So firstly, I hope everyone is able to see my video and hear my voice. So if you can hear my voice, you can just say hi, you can just say yes. Oh, fantastic. Very good. I believe I'm pretty audible to everyone. Let's do a short poll by getting introduced with each other. So I'm going to launch a short poll. We just want to understand about yourself, about your profession, where are you from. So I'm going to launch a short poll. I would request if you can do a short introduce yourself and let us know your present location. Uh, I will be delighted to see to know everything about yourself. I hope the poll is visible on in front of your screen. You just have to poll that you have to introduce yourself and your present location. Oh, that's very good. A lot of people are from Delhi, Maharashtra, Kerala, uh, Ayurvedic doctors, spa owners, couple of distributors also I can see that they have joined in. So nice. It is also good for a distributor or a super stockist or a PCD to know about Ayurvedic diseases, Ayurvedic management of specific problems. Great, very good. I can see a lot of people are from Maharashtra, Delhi, Kerala, and rest of India. Ayurvedic doctors with doing clinical practice, very good. I'm so glad and grateful for all the doctors who have joined in and who have given time to learn something from this webinar and take a lot of insights from this webinar. I'll just in the next 30 seconds, I'm gonna just end this poll. I would request if you all can just poll right now. I see few people have still not done the poll. So I hope you can. A lot of people are saying there's no audio. So anybody, I believe, please check your internet connection, please. Oh great. Oh great. Okay. So I'm gonna end this poll now, and let's continue with this webinar. Uh, So I hope, so we all know that we have been really, we had a really very challenging times in the last 2.5 years. And we all know that Ayurveda played a vital role in every household to safeguard our lives. And I hope you and your family are all in good health. So I would really like to thank you all for taking time to participate in this virtual CME. This CME was especially for Ayurvedic doctors and the entire Ayurveda fraternity. And I'm so delighted to share with you all that we received more than 2,000 registrations, and I'm grateful to all of you for your support and participation. So during the webinar, we did a poll to understand that who all are attending this webinar for the first time and who all are attending this, who have already attended this webinar, Kairali webinar. So again, a refresher to everyone and good information about Kairali Ayurvedic Group. A little brief about the company. Kairali Ayurvedic Group is a 111 years old Ayurvedic brand, manufacturing more than 923 SKUs that comprise of traditional medicines, proprietary medicines, cosmetics, herbal teas, and many more. So Kairali is on a mission to spread Ayurveda across the globe, and I want you all to be part of a mission to spread Ayurveda. So if you are on a mission with me, just type mission Ayurveda. I would like to see that. I hope everybody is in the mission with us on spreading Ayurveda across the globe. Let's type mission Ayurveda on the screens, on the chat box. The chat box is open. I want to see who all are there in this mission with us. Just type mission Ayurveda in the chat box. Oh, great. Fantastic. Fantastic. Dr. Divya, all Puneet, Ghanshyam, Dr. Preeti, Dr. Anushri, fantastic. I'm so delighted that everybody is on a mission to spread Ayurveda across the globe. So, great. I'm so delighted. Fantastic. So that's nice. I'm so delighted to see the participation by you all. So this just to run through a brief about this webinar. This webinar will run till 5:15. I want you all to stay with us till the end of the webinar, and we have a lot of surprises for you all. So our speaker of this webinar will share a lot of valuable information that can't be missed out. So I request you all to put your notifications on silent mode. So it will help you to focus more on the webinar. And we will also have a Q&A session at the end of the webinar. We will also have a Q&A session for 15 minutes. We will give you a brief about Kairali Ayurvedic products. Our keynote speaker, Dr. Satya, will be talking about Ayurvedic management on knee OA osteoarthritis. Mr. Puneet Endley, who is the Vice President Sales, he'll be briefing you about the products. We will be also announcing the gift vouchers and plus the 3 winners who asked the best questions. And also we will be announcing for the participation certificates as well. So I request you all to stay with us and focus on the webinar. This webinar is an exclusive webinar. Recording of the webinar will be done for sharing purposes. It will be also uploaded in YouTube. We are also live on YouTube. We will be emailing everyone a participation certificates of the webinar to every attendee. I will repeat myself, where certificates are only applicable for attendees only, not for the people who have only registered. Just to maintain the sanctity of the webinar, we will only issue certificates to the attendees. So sit back and relax, and let's start the webinar with full energy. So are you guys with us? Let's type again. Let's type Mission Ayurveda. Great, very good, fantastic. So over to you, Dr. Sachin. Let's start the webinar. Let's start the presentation. Please introduce our keynote speaker. And for everyone, I will have to shut down the chat for a while. We will shut down the chat during the presentation. Whatever questions you have, please post it in the Q&A box, or you can write down on a notebook, and you can post it at the end of once the chat box is on, once the Q&A section is on. So over to you, Dr. Sachin.
Thank you, Rishabh, and namaste to all my friends, colleagues, seniors, everyone. Welcome to this great webinar on a very interesting topic and a very common ailment, that is osteoarthritis of the knee joint. घुटने का गठिया, ये बहुत ही कॉमन बीमारी हो गई आज के टाइम में. इट इज वेरी कॉमन. Everybody who is almost 55-60 plus, they have this problem. So we have, before getting into the webinar, let me introduce myself. I am Dr. Sachin Rewar, into the Ayurveda industry since last 20 years. And I have my own clinics, and I'm associated with the Kairali. And it's a great company, a great Ayurveda group, who is very serious into the treatment industry, serious about treating the people, serious about giving relief to the people from their ailments, from their problems. To address these issues of ailments, common problems, we have started series of webinar on common ailments, wherein we invite great, highly experienced doctors, seniors, who have great insights on the subject, and they provide us guidance how to successfully manage the problem, the common problems. So let me introduce today's speaker. I hope most of you are aware about him. Most of you know him. He's a very senior physician, very senior doctor, Dr. Satya N. Dornala. Presently, he is working as Panchkarma specialist at Swami Vivekanand Ayurveda Panchkarma Hospital, Delhi. He is master's degree. He did his master's degree in Kaya Chikitsa, MD in Kaya Chikitsa, MS in psychotherapy and counseling, which is again which plays a very great and vital role in the management of all the diseases. Unless and until you are able to successfully counsel a patient, his suffering will not go by any medicines. Even without medicines, by successfully counseling the patient, we can provide relief to them. So Dr. Satya is great psychotherapist. He's a great counselor. He holds a PhD in Panchkarma. He is having PG diploma in hospital and healthcare management. He is a Vaidya scientist fellow from Bangalore. He had a certificate in health and research fundamentals from ICMR. He is having certification in writing in the sciences and statistics in medicine from Stanford University. He is recipient of many awards. To mention few, he is recipient of Dhanvantri Award 2018 for excellence in Ayurvedic practice by Association of Ayurvedic Professionals of North America, that is APNA. He had received Pranacharya Award in the year 2017 by Shri Indraprasthya Vaidya Sabha, Delhi chapter of All India Ayurvedic Congress, New Delhi. He earned Dhanvantri Award in 2016 for excellence in Ayurvedic practice by APNA. He is an eminent speaker award. He got eminent speaker award in 2016 from IMA, that is Integrated Medical Association, Ayush, Delhi. He got honorary professor title from Maharishi European Research University, Switzerland in the year 2015. International Aryabhat Award 2009 for excellence in Ayurvedic research by APNA, and Best International White Paper Award in 2009 from TAFSA, that is the Ayurvedic Foundation of South Africa. He is a resource person for certificate course on health promotion through Ayurveda and Yoga, being jointly conducted by Ministry of Ayush and Indian Red Cross Society. He had delivered many lectures, many sessions. He is a learned physician. He is a great speaker. He is a great knowledgeable physician, doctor, who is serving the society, who is serving the mankind. He had conducted many web radio talks, that is Mukta Vidyavani of National Institute of Open Schooling under the Ministry of HRD. He is into editorial board member and reviewer of many Ayurvedic journals. He has authored more than 5 books, 50 scientific articles, and delivered numerous lectures at various national and international platforms. So we are fortunate to have him here today as a guide, as a keynote speaker, to help us in successfully managing osteoarthritis clinically. So I take this opportunity on behalf of Kairali and all my colleagues and friends who are present in this webinar to please welcome Dr. Satya. Sir, please
Yeah, thank you. Hope I'm audible.
Yes, sir.
Yeah.
Yes, doctor.
Thank you, one and all. And at the outset, let me thank the Kairali group for making me part of this Mission Ayurveda project, connecting with the people where they are living in unconnected areas. So it's a great initiative, and particularly I thank Dr. Sachin for insisting me to I should speak on this. So thank you, Dr. Sachin and Rishabh, for coordinating this. And I thank one and all who's a part of this program. Yes, you all are here to, I rather think it's a kind of knowledge exchange program, rather, because as you people are already into the practice, yes, you people must have some of the participant must have the vast experience than others. Yes, everybody has their own approach and perspective. Yes, we all are here to exchange. Ultimately, our overall the mission is mission Ayurveda should grow. The mission Ayurveda will grow only when we are here to exchange our all ideas and the knowledges. As we all aware, when I was in a student, so Ayurveda was considered to be in a way, the science of secret. एंड ये भी कहा जाता है, अरे यार कोई भी चीज आपका जो होती है ना सक्सेसफुल, आप बोल दोगे ना उसकी सक्सेस, उसकी जो पावर खत्म होती. It was also there, still there are people still believes this also. So but as we people of 21st generation, and we are going to be see the transition into artificial intelligence era. So everything should be open, and it should be discussed and debated, and maybe there is a descent of the ideas and the. So ultimately it's the growth of the science. And for very simple, every science is to serve the very purpose of the science is to serve the society. So Ayurveda is considered to be science, so naturally it has to serve the society. But science as such never goes to the society. So people like us, we take this knowledge of light of Ayurveda to the society. And whereas the institutions are the connecting link between the science and society, we are being produced by the institution. We take this light of knowledge to the society and to ultimately indirectly serve the society. So that has to be, if anything is there, if something is there in the lacuna in the system, it is not the fault of the system. It is ultimately the onus comes on us. Whether really we are serving the society, we are really taking this knowledge of Ayurveda as in totality to the society. So that is very important. And one more thing, I'm particularly more emphasize, though we respect the science, but ultimately the interest of the patient is also to be taken into consideration. So when we studied, when the science was written, the Pada Chatushtaya, Bishak Dravya Upasthata Harogi, Bishak was the supremo of the Pada Chatushtaya, supreme of the head of the Pada Chatushtaya. But in the current times, though it is a bitter fact, so the corporate hospitals are going to the patient, they are ready to serve the patient at his doorstep. So that's how indirectly this is a great transition, a paradigm shift from making a Vaidya from Supremo of Pada Chatushtaya to the patient as in Supremo of the Pada Chatushtaya. That is a major paradigm shift and the major transition. So that also to be taken into the consideration. And we have a peer pressures from the our own people, our own eye systems, and our own allopathy system. So that's how. So the particularly in this era, that is Google era, whatever the medicine you prescribe, patient immediately Googles it and he asks a number of questions. So that is how difficult. Definitely, it's a very difficult task to do in this era. So we'll see, and I'm here to take you something. It's not the something. Maybe some people in the participants are expecting. Sir, tell me this medicine. What is the medicine for osteoarthritis? If such is the case, even no need to join this this webinar. Just you can ask in the Google. Google will give the best answer. But we are here, we are here to interact that what is the best approach. So it's not that whatever the pain, knee joint pain is, everything is a Sandhivata, and without going to the details of what exactly the specific cause, we can't precise the treatment. We can't. We are doing the whatever it may be the reason we are doing the Januvasi for the same oil. So rather we understand the precise cause, then we precise the management and the treatment. That actually makes the better outcomes in the patient management. Yeah. So I'll share the screen. Hope screen is visible.
Yes, doctor, we can see your screen.
Yeah. So just a minute.
It has to come under presentation mode. No?
Yeah,
we can
yeah, I'm doing that.
Okay.
Just a minute. Oh, it's okay.
No, doctor, we can still see you. You just have to select another tab on the share screen. Go share screen. Just select another tab or presentation tab. It will come.
So there is a share screen. Fine.
Yeah, just share screen.
Yeah.
Then you go to present. Just click on the presentation. Then when you click on then Alt and Tab.
There is a screen and the share sound, optimize the video clip. So
you can select the screen, share screen, then you select screen.
Yeah, I have selected the screen.
Now share the presentation. Your presentation will be live. It's coming up. Now click on that bottom right. See 65%. It's written over there.
Yeah.
Just click on that.
Just a minute.
Resume slideshow. Yes, correct.
Now it's in slideshow mode. No,
it's coming. It's
coming.
Something is working.
No, it's not. Slides are not moving. No. Yeah, I'll do one thing. I'll share the PDF.
Doctor, share the screen. They share the presentation. I'll play it out.
No problem. I'll do one thing. I'll share the PDF of the PPT. That will be fine.
That is also fine.
So the reason I made this arrangement, just this. Now it's okay. Hello.
Yes, doctor. Yes, doctor. It's fine.
Yes, sir. We are able to see that, sir.
Now it's fine. Yeah. Yes. So now, so as I said, I thank the group, Kairali group, and the Dr. Sachin. And my talk will be on Ayurvedic management of knee osteoarthritis. So you know, earlier the talks was osteoarthritis. Osteoarthritis may affect any joints of the body, but I am very specific to the knee osteoarthritis. So you know, knee is something which is in the major weight bearing joint. And these days it has become so common that you know, people are very these days knee replacements become so common, and the reason maybe you know, insurance backup. And what will be the contemporary issues and challenges and experiential insights. So how will we look into this, and how we'll take as a challenge in day-to-day practice. Yeah, moving further. Copyright and disclaimer, whatever the content in this lecture, you are free to copy it and adapt it, use it. But as a matter of ethical practice, it's better to acknowledge the source. And recipes prescribed in this lecture to be used strictly under prescription of registered Ayurvedic medical practitioners only. The reason why I'm mentioning this particular lecture is being floated on the YouTube as a live. So not only the doctors, even other clientele from whole world is viewing this. So it is better to have this disclaimer so that there will not be any liabilities and legal issues. Yeah, coming to the introductory part. And this ever desire of the human beings and most of the scientists in the entire world is longer lives. So the people wants to live forever. So that's how it is, ever desire is the longer lives. Yes, the scientists and we people are really successful in adding years to life. And years to life means when we got independence in 1947, the average lifespan was probably around 30 years, 35 years. And almost after 75 years, we are reaching almost. And this is, as on date, is almost 70 years is the average life expectancy in India. So it is more than double. So that is how we could add years to life, and but forgot to achieve life to years. That is, so though we are increased our lifespan 35 to 70, but we are being affected with the n number of illnesses we call as a chronic non-communicable disease, lifestyle disorders. So in which very common is A is arthritis, B is the blood pressure, C is the cancer, D is the diabetes. So these days, probably you people must have come across people at the age of 30, 35 are also visiting your clinics with a knee joint pain. So that is something, the life to years. So though we are living up to 75 years, we are being diagnosed with some any chronic issue at the age of 35, and he has to be remain on that particular illness part to be remaining part of the remaining 35 years of the life. So that's what the cut to life to years. And these days, this NCD, that is non-communicable disease, also there are other form of that is novel communicable disease, for example, COVID. So these NCDs are ruling the world. So that is non-communicable disease, another one is novel communicable disease. So that is very important. And particularly in this non-communicable diseases, the pain aspect, pain maybe because of n number of problems, this persistent pain is a major public health problem in today. And I'm writing in a book, particularly as the title of the book is Gugulu Sangram. When I was collecting the data from across all the Samhitas, it was found that many Samhita, almost I found 120 Gugulu, different kinds of Gugulus, and there are Gugulu on the same name, different formulations. Maybe Amrita Gugulu, one Samhita mentioned 2-3 less ingredients, and other Samhita there are added 2-3 more ingredients. That was as a total, it's 120 Gugulu formulations, and that itself shows that this pain management is not the problem of real problem of these days. It is also the problem during those good old days also. And those scholars of those days, they have tried their best. They tried their best and started one Gugulu as a single ingredient and started 2, 3, 4, 5. And I found in one Samhita there is a Gugulu by name Shadashidi Gugulu. That means that Gugulu consists 86 ingredients. So that itself shows that pain management was a real tough task even during those golden days. And even look at the prayer of the Bhagavan Dharmata, Namami Dhanvantari Madidevam Surasura Irvandita Padabadmo, Loke Jara Ruk. Jara means this particular quotation gives what are the popular problems of those days. Loke Jara is old age, Ruk is the pain, Jara Ruk, Jaya Brutyanasham, that is death. So these are 3 conditions are the main popular issues of during those days: old age and the death and the pain management. So that's how the pain management is always a challenge for the medical fraternity. Or 1/3 of world population suffers from persistent or recurrent pain. We can't allow our clientele or the patient to suffer from the pain, because the right to pain control, adequate pain control, is a fundamental right of every patient and every clientele. We can't allow that आप दवाई लेते रहो, आप धीरे-धीरे ठीक होते रहेंगे और इतना patient दर्द से बड़े तड़प रहा है. So that should not be so. So yeah, coming to as I mentioned, global life expectancy, not only in India, global life expectancy is projected in 2100. So it is expected to be 83 years. Even in 2015, we are as per Indian statistics, latest statistics, we are in 71 years, not only in India, in the whole global life also increasing. So here right side CDC says that arthritis will increase as the population grows and ages. And as I did, there are 54 million people are there worldwide. And as from the 2001, as it is increases, this will increase almost to become 78 millions. As it is a known fact that arthritis will increase with the age. So this figures actually gives the potential where the clientele, the potential of the clientele we have in the coming future years. So that actually gives us a challenge and to prepare ourselves to that, to tap the potential of the clientele. And coming to the 5 most common serious types of arthritis, And among them, the first one is the osteoarthritis of the particular the knee joint. We could see the 27 million people, and the fibromyalgia these days, it's a very common 5 million, and the 3 million, and rheumatoid are 1.5 million. So that's how osteoarthritis is a major focused area. So these days, because as it is a major weight bearing joint, so every individual in once in his lifetime may suffer a kind of maybe transient pain. So that may be for the particular period, or maybe for weeks and months, and maybe go, or maybe through the lifetime. So that's how the OA knee is osteoarthritis of the knee is very important. So coming to the question comes then, what is arthritis? Is all you know. So it is a generic term that includes group of disorders that affect your joints and muscles. Remember, arthritis means it doesn't. Usually, the moment you say arthritis means usually we blame only the bones. It's not the bones only, the joints only. It is also the muscles. Also, arthritis includes joint pain, inflammation, and the tender warm to be touched. But particularly when it comes to osteoarthritis, it is something. It's a clinical syndrome. You see the definition: clinical syndrome of joint pain with multifactorial etiopathogenesis. We can't ascribe this is only the reason for this you have developed. Maybe this may be the possible in traumatic cases, but it may not so in other cases. It is a multifactorial idiopathy that is characterized by the gradual loss of articular cartilage. You see this sequence. First, there is a loss of articular cartilage, then osteophyte formation, then subchondral bone remodeling, and inflammation of the joint. That's how this is in a routine. If there is any traumatic, then definitely there will be a tear. That is how the course will be something which is different. This is very clear that is a clinical syndrome of joint pain with multifactorial etiogenesis. See, the moment you say it is multifactorial etiopathogenesis, then we need the people from the multi-diversified fields of sciences. It's not that. Don't be in overconfidence that we Ayurveda people can only do everything and all the conditions of all the severity. It's not so. As it is science, wherever we need, we can take the aid of the other sciences, ultimately in the interest of the patient. So be open, keep the mind open, and wherever there's a best possibility in the interest of the patient, so can be adopted, and nothing is wrong in doing that. Yeah. So coming to the classification, arthritis generally, as you all know, arthritis in a general, just maybe there's some new doctors are also maybe in the group. So arthritis are the inflammatory and non-inflammatory. And inflammatory is, there are seropositive, maybe seronegative, infectious, and crystal induced. Another one is a non-inflammatory. Most of the degenerated joint diseases, usually, particularly knee osteoarthritis, usually it is a non-inflammatory one. And whereas seropositive and seronegative, you can have a look on this. Yeah. So how can you differentiate between the inflammatory and non-inflammatory? That is very important. The question comes whether it is really an osteoarthritis. And see, osteoarthritis never develops as such directly. So there may be some other causes which is leading to the other condition. So that has to be kept in mind. Particularly the question comes pain. How to differentiate inflammatory and non-inflammatory? Pain. When usually you see in the inflammatory conditions, usually patient when he gets up in the morning, he feels the pain in the joint. That is AM. And whereas in non-inflammatory cases, that is PM, by the evening, as there is the weight-bearing joints, being in a weight-bearing joint causes the pain. Usually we see the non-inflammatory. And swelling, usually inflammatory, there is soft tissue swelling, whereas the non-inflammatory is a bony swelling. And erythema we see sometimes in inflammatory, whereas in absent in non-inflammatory, Similarly, warmthness also we see sometimes in inflammatory cases, and AM stiffness, that is morning to subage stiffness would be prominent in inflammatory, whereas very less in the non-inflammatory cases. And systemic features sometimes they're in inflammatory, whereas it is absent. And raised DSR and CRP more common in inflammatory, whereas uncommon in non-inflammatory. And synovial WBC is more in inflammatory, whereas less than 2000 in non-inflammatory. And the examples for inflammatory septic arthritis and rheumatoid arthritis, celiac and gout, whereas non-inflammatory is osteoarthritis and vascular necrosis. Yeah, coming to, as I mentioned, osteoarthritis is a degenerated joint disease. It is the most common form of arthritis. Global statistics reveals 100 million people worldwide suffer from OA, which is one of the most common cause of disability. It is affecting the health-related quality of life. So it is affecting the productivity of the industry. So it is something which is directly and indirectly linked to the development of the nation also. So that is also the important. Globally, OA is the eighth leading cause of disability with the joint, most frequently associated with the disability being the knee. So this usually we see in the fourth and fifth decade of life, and even these days we could see in the third and fourth decade of life also. What makes the knee joint so unique? Because it's the most complicated joint, and mainly it is a weight bearing joint. And remember, this weight bearing joint is how much weight it will bear. For example, imagine if you are in a 50 kg an individual, your joint is in a fit enough to bear the joint 1.5 times, that is 75 kgs. So it to that too in the vertical position. In the vertical position, even a weight bearing joint, knee joint, can bear up to 1.5 times the weight of your body. So that itself gives a clue that a clue that. So while doing in gyms, so don't lift the weights which is 100 times more than your weight. For example, there are people, so that is very important. And particularly in the horizontal time, even he could not, even half of your body weight also could not bear your knee joint. That is very important. So coming to the, as I'm mentioning that, not only in the case of knee joint arthritis, anything, if any problem, any clientele came to you, any patient came to you having something, maybe let's imagine lumbar spondylosis. So it's not that, just to understand the thus anatomy of that particular, and if possible there is a functional anatomy, and that is very important, that so that we can understand, we can precise the treatment, and that is so focused that so it will address and there will be better patient outcome. So I adopt in my practice in these days. So better just to, maybe you people must be aware of the anatomy of the knee. So it is better to have while learning, there are 3 steps of the learning: learning, unlearning, and relearning. So its point is, learning means you are the first to that particular new knowledge. That is what the learning. Relearn means, so sorry, first one is learn, second one is unlearn. Unlearn means maybe in the due course, if you are not into the practice of that particular the knowledge, maybe you forget that. That is what unlearn. Otherwise, you know that particular aspect, but again you are listening to that. You think yourself that you are not aware of anything about that. Until unless you don't think, that is what unlearn. You don't think that the new knowledge will not enter into your the thought process. That is very important. And then again you will relearn. So then you mix up that, and the next the level of the knowledge and the level of understanding, level of the perception will goes to higher levels. That is very important. So I rather insist that just to have a broad perspective, how to look into the knee, and based on that, how your the treatment strategy, the planning of the treatment will differ. So just have an idea. Knee is composed of bones, cartilage, ligaments, muscles, and tendons, and joint fluid and knee capsule. All these has to be taken into consideration. Usually हम जैसे भी कोई भी हम घुटने दर्द से कोई भी patient comes to us, हम कहते हैं यार संधिवात है, कर लो जो भी है, जानुवस्ती कर लो, पोटली कर दो, दवाई दे दो, and हो सके तो कषायवस्ती करो. Yes, maybe you are doing Januvasti, maybe you are doing Kashayavasti, maybe you are doing something else. Yes, but it's not that you say Kashayavasti. The selection of the medicine we choose for the Kashayavasti, maybe Kashaya, maybe the oil, maybe the Kalka, that may differ. So considering the original, the Agantuja, or maybe the Nija Karana of that particular condition, maybe the Januvasti, the selection of oil will differ considering maybe the ligament tear, maybe the cartilage depletion, maybe the depletion of the spinal fluid. So considering those aspects, we can pick the exact and pinpoint the oil or the medicine. So definitely there will be better patient outcomes. So these bones, cartilages, and ligaments, muscles and tendons, joint fluid, and knee capsule are the important. And this is a pivotal hinge joint. It permits bending and extension, and internal and external little bit rotation. And the bones of the knee joint. And yeah, as I mentioned, these are then what are the bones and the knee joint, and what are the joint? Though it is we consider as a knee joint, again it has 2 to 3 joints. The bones are the thigh bone is the femur, and the kneecap, patella, and top section of the tibia, that is shin bone. These 3 bones are the take part in this joint. And further there are 2 joints. We see tibiofemoral joint, and there are 2 aspects. One is the medial aspect of the tibiofemoral joint, and the lateral aspect of the tibiofemoral joint, and the patellofemoral joint. So these are the
So the moment you say knee joint, again we have an a. So I say the three joints, three bones, three joints. That is middle aspect of the tibiofemoral joint is also considered as one, because this is a separate compartment, and the separate other one is the lateral aspect is a separate compartment, and the patellofemoral joint. So it is, we call it a joint of the joints. As I mentioned, the compartments: medial compartment, lateral compartment, another one is the patellofemoral compartment. So as I said, there is a joint between the femur and tibia. On the inner side of the knee is a medial, and the lateral side is the lateral compartment. And the patellofemoral compartment is a joint between the kneecap and its groove on the femur. So patellofemur, that is patella, attaches to only the femur, not the tibia. So that joint is also there. And so these three compartments gives that there are three joint spaces. So that is very important. Yes, it's a joint is the reason we mentioned the uniqueness of the joint is a complex joint, and it's a complicated joint. And particularly this just give the three bones. The top one, this one is the femur and the knee, this kneecap and the shin, and these are other ligaments and the joints. We'll go one by one as now we discuss the bones and the joints and the ligaments of the knee. So there are the 6 ligaments. Otherwise, the primary ligaments are what exactly? As you discuss about the joint, the bones, as to keep the bones in position. So there will be the attachments in between the bones. So ligaments are the the muscle, the fibers which attaches to the two bones, as we learned in the first and second years of our graduation, that is ligaments such as bone to bone. So particularly in the attachment of this, particular to keep this shin bone and femur and then patella, these 4 are the main crucial ligaments. Still we have other ligaments also, fibular collateral ligament and coronary ligaments and meniscotibial ligaments. The major ligaments, these particular ligaments, the useful in give the joint stability. So they attaches the different joints. That is, these are ACL and ACL. These days, many patient comes with the ligament tear. Anterior cruciate ligament, posterior cruciate ligament, medial collateral ligament, and lateral collateral ligament. Don't think that we'll do whatever there be the ligament. If it is the cruciate ligament tear, so it will be more of deep seated. Whereas the collateral ligament, it is something which is present in the superficial aspect. There the approach will be something which different. So that is how I was insisting. If it is cruciate ligament, we should know where exactly the position of this anterior cruciate and posterior cruciate ligaments, and medial and collateral ligaments. So that is very important. These are the 4 major ligaments. As I mentioned, 3 bones, 3 joints, 4 ligaments, and other even these ligaments, coronal ligament is also there in the maintenance of the stability of the knee joint. And these are the, if you look at this, this is a cruciate ligament present inside the joint. And whereas the collateral ligaments, this is the collateral ligament. This is a fibula, and it attaches from the outer side. This sides of the joint are the lateral collateral, and this one is a medial collateral. So these are the outer side. So if somebody says the lateral collateral, medial collateral, you should more focus on the inner side or lateral side of the joint. If it is mentioned as a cruciate ligament tear, then you should look into the inside of the joint. So this difference has to be very clear in the mind. So that we can focus. Even for example, somebody came to the lateral ligament, you are putting the Janus here. So then something which is rather we can put like this in this side, lateral aspect of the medial, if it is the lateral one, lateral outer side, if it is the medial one, this side. So that is a more focused and the pinpoint treatment. So the reason I'm trying to make a differentiation and the clarity, how the anatomical structures are being involved in the causation of this particular condition, how focusedly we do the treatment. And after the ligaments, then we'll move to the muscles. So muscles support the knee. Muscles and the tendons, muscles and tendons allow the knee to move. Remember, bones and joints are makes the formation of the joints, and whereas the ligaments keep the intact, the bones are being keep in intact by the support of the ligaments. Then they maintain, the ligaments maintain the stability, whereas the muscles and tendons support the knee for the movement. So for the movement of the knee, muscles and the tendons are particular these 2 muscles, hamstring muscles and quadricep muscles. Hamstrings muscle present on the back of the thigh, whereas the front of the thigh by the quadricep muscles. So back of the thigh muscles to bend the knee, whereas the front of the thigh, that is quadricep muscle, to straighten the knee. So that is very important. Remember, कभी भी हम कोई भी पेशेंट हम घुटने से आता है, घुटने में दर्द हो रही है, बेंड करने में दिक्कत हो रही, हम सिर्फ घुटने घुटने के करके भेज रहे, but it's not so, because the movement of this releasing and bending and straightening of the knees are being controlled by the hamstring and quadricep muscles. So the reason whenever we do the treatment, it has to be supposed to be whole leg from the almost, you know, the what to say, groin region to the whole front of the knee and the thigh and the back of the thigh also. The also has those all muscles has to be modulated, and those muscles has to be relaxed. If somebody having a knee joint pain, naturally, maybe if you touch the hamstring muscles and quadricep, you feel the hardness and stiffness of those muscles. Because of the pain, patients tries to make different changes while walking. So that's how the muscles are becomes straight and the stiff. The stiffening of these muscles further causes makes the change in the alignment of the knee joint, that further causes the pain. So that's how the oil application and Abhyanga has to be in the both the lanes from the groin regions to the to up to the below and below the knee also. That is very important. Usually I do in this my practice. So muscles also be taken care while doing the treatment. It's not that you just apply the oil on the knee and do the Janudwara and you're sending. So that should not be so. Yeah. And coming to the tendons, so tendons are the group of the muscles will unitedly form the tendons. The tendon supports the knee. The muscles join together to form the common quadriceps tendon. These tendons are the part of the muscle and attach muscle to the bone. So this, if you look at this image, these are the quadriceps muscle from the front of the thigh. It will all go unitedly form the quadriceps tendon. It will insert on the patella. And this another one is also, that is patellar tendon. This originates from the patella and gets inserted on the tibial tubercle. So this we can touch from our hand, every individual. So then there is a chance of if there is a direct fall on the knee patella, then there is a rupture, a tear of this patellar tendon also. So this is a quadricep tendon and the patellar tendon. So this is very important, that if somebody says this, there is a tear of this quadriceps tendon, really where exactly you have to do, and that is very important. Yeah. So moving further, then after that, after the bones and the joints and the ligaments and the muscles and tendons, coming to the cartilage that support the knee. This cartilage is a weight bearing material. Wear bearing material. As we do different kinds of physical activities, there is a naturally wear and tear in every tissue and every organ of the body. So this cartilage is the wear bearing material, and there are two kinds of cartilage in the which are really support the knee. One is articular cartilage and one is the meniscus cartilage. Articular cartilage covers the bone ends to provide a slippery surface, whereas the meniscus C-shaped piece of tough rubbery cartilage sits behind the ends of the shoe. So I'll show you in the image. Yes, you see. So these are the where exactly this in particular in the knee replacement, this cartilage is being replaced, and these are the inside of the kneecap, and this again the cartilage. And whereas the meniscus, the present above this cartilage, they acts as a meniscus, the shock absorbers or the cushions, whereas the articular cartilage allows bones to glide smoothly against each other. So that is the cartilage, and there is a meniscus here and above this on the shin bone. And how this grade 4 it will come, this is how the cartilage, and as this has this mild, the moderate, and you see the whole destruction of the cartilage, and the bone ends are directly in contact with the shin bone. So that causes a more pain. Even in this case, the patient could not even fold the joint. So that is how. So coming to the next one, after that there is a knee capsule. So that is knee joint capsule or the knee capsule. So dual layered structure that surrounds the knee joint. It is relatively thin anteriorly and the posteriorly and thickened laterally by the collateral ligaments. The outer layer of the knee capsule consists of the fibrous connective tissue hold the joint in place, whereas the inner layer consists of synovial membrane which secretes synovial into the joint lubrication. One important point here in the knee capsule is there is no capsule above the patella. This is the weakest point where exactly when you put a kneecap, that is Januvasti yantra above the knee, So this is the point where from oil can more percolates and penetrates into the system, and so that it modulates the vata at that place, allowing the supra. I'll show the image how the more of yeah. So, and as I mentioned, there is an knee capsule. Inside the knee capsule, inner layer is being produces a synovial fluid that we call a joint fluid. Body naturally produces substance known as synovial fluid. It is a sticky jelly-like fluid found in the joints, helps the joints to move more easily and lubricates cartilageous surface. And if you look at this synovial fluid produces synovium, and the composition of this, you see macromolecules, salts, lubricin, aggregates, and cartilagine, and particularly the hyaluronic acid. Particularly, this hyaluronic acid is also present in synovial fluid and joint fluid. I'll discuss about this significance of this, the hyaluronic acid present in synovial fluid, how we apply this in the clinical practice. I'll discuss in further slides. So this is how the joint capsule, the same thing which is given, this is joint capsule, and this is synovial membrane, and the fibrous capsule, this one, and this is articular cartilage and articular bone, and this one is synovial cavity and contains synovial fluid. So this yellow one and this is a synovial fluid. As it further dries up, there is a possibility one is getting dries up if there is a more of vata dominance. Then if it is dries up, and if it is more of kapha dominance, it gets solidified. That causes the fusion of the joint. So it's something which is a disc of the, it is a disc of the knee joint. Yeah, coming to the popliteal fossa, these are the different parts of the your knee joint. These you should aware of these, that so that we can plan a treatment considering the where exactly the problem is there, and we should plan so accordingly. So popliteal fossa or knee pit, which is present behind your knee, it is a diamond and rhomboid shaped fat filled space. The space is extremely dynamic, allowing for the neurovascular contents to move during the extreme range of motion produced by the knee flexion and the extension. And knowing is very important when you put, remember, when you put the kneecap yantra, that is, fiber kneecap yantra, it should be towards lower side from the front aspect. When it comes to the back side of your knee joint, it should be bit to above. So it's not in exactly the middle, because this particular popliteal fossa is it is above your exactly the grease of your knee joint which are present in the behind your knee. So while putting that locating that the knee Januvasti yantra, it should be bit above your grease. Your B should come in below your center of the Januvasti yantra, whereas it should be towards the lower side in the front aspect of your knee joint. So that is very important. And moving, so this is something about what exactly the knee joint, where we are going to do some management. And usually, whosoever the patient comes with the maybe client or the patient came to you, maybe having a 2-3 months history. Usually, anybody in routine practice, almost 98% the clientele never comes to particular Ayurvedic physician directly. So they go here and there, and if somebody says you have to undergo this, injection, you have to take this, surgery, then they look for alternative approaches. But whosoever comes to us, usually in general, the objectives of the management is, so anybody comes to us, naturally they come to us with the primarily the pain. So our immediate goal should be naturally manage the pain, and second one is maintain the mobility, and third one is minimize the disability. So this is very important. Again, the objectives for the management is the 3 M's. First one is manage the pain, second one is maintain the mobility, third one is the minimize the disability. Ultimately, these are the 3 objectives, because the first one, immediate objective is to manage the pain, and the short-term goal is maybe down the line 3-4 months, that is to maintain the mobility, and the long-term goal is to minimize the disability. Immediate goal, short-term goal, and the long-term goal. We can't minimize the disability in a day and second day. So it takes down the line maybe 6 months and 1 year, whereas the mobility it makes 3 to 6 months, and the pain the patient could not wait. He wants immediate pain relief. Maybe he can wait up to a week or 10 days or the 15 days. We can't allow the patient to the being suffering from the severe pain. Yeah, so naturally this is a laid down standard protocol for any management of any disease. Nidana Parvarjan is ultimate. Even we can say this itself is the 50% of whole management. And usually the moment I say Nidana Parivarjana, naturally question comes, then what is Nidana? So Parivarjana means Nidana is a causative factor, but I am not aware of the causative factor. Is the patient aware of really the causative factor? It is your duty to evaluate what exactly Nidana, which is leading precipitating this particular pain. So the reason in my practice, in my understanding, I analyze the Nidana, Parivarjana, Nidana as an Ayurvedic physician, we should more emphasize that is Nidana as a diagnosis of the Nidana, that is causative factor, not the diagnosis of the disease. In most of the cases, patient comes to you, तो जैसा वो बैठते ही कहते सर मुझे घुटने में दर्द है और डॉक्टर ने बोला 4th grade knee osteoarthritis है. So as an Ayurvedic physician, not only in this particular management, in every disease, as a physician, if you want to do Nidana Parivarjana, your primary job is to, instead of doing the diagnosis of the disease, we are supposed to do primarily diagnosis of the causative factor. Diagnose the causative factor, then later you can do the diagnosis of the disease. So that is very important. Without diagnosing the causative factor, we can't ask the client and the patient to avoid the causative factor. It is something which is general causative factor. So your duty is to pinpoint the specify what are the causative factor which actually really precipitating more. There are other associated causative factor, but there is a direct precipitating factor has to be find out, and we should ask the patient to avoid those causative factors. So, and Nidana is usually there are 3 aspects, that is Ayoga, Ati Yoga, and Vidya Yoga. This is actually suitable to this knee osteoarthritis. Ayoga means that is underuse. We are not using. Usually in the sedentary lifestyles, people sitting the desktop jobs for hours together. So not much any vertical standing, and that's how this is Ayoga. And coming to the Ati Yoga, the anything which is overuse and excessive use, that is long standing for hours together and long driving, and people are driving in a day almost 200. One side, maybe one part of Delhi is going to other part of the Delhi. Gurgaon, maybe is driving one side is 70 kilometers, other side is 70 kilometers. Every day is driving 150 kilometers. So naturally, it is Ati Yoga of the knee joint, and overuse and over running and over jumping and excessive intelligence and excessive intelligence sex. These are the Ati Yoga. And Vidya Yoga comes to walking on uneven surfaces, sitting on in unusual postures, and eating and drinking in standing posture. So these are the different perspectives considering in the contemporary era how the people are having the lifestyles. So I try to make this category in Ayoga, Ati Yoga, and Vidya Yoga. So ultimately, it is our job is to if it is in the case of sedentary life, we ask the clientele, just you after every half an hour, just you stand for an 5 minutes, having a 5 minutes walk after every hour or 2 hour. If in Ati Yoga case, we ask the clientele to minimize that, and even in Vidya Yoga case, we ask to avoid that. So that's how, if it is in Yoga, we can bring it to the balance, and Ati Yoga, we'll ask the clientele to give the rest for some days, and Vidya Yoga, we ask the clientele to patient to avoid that. So that is how the Nidana Parivarjana is, a kind of lifestyle modification and dietary modification. Yeah. So these are other contemporary causes. So osteoarthritis, I made an acronym. Osteo means O means old age, and osteoporosis, S means sedentary lifestyle. There are skin disease, there is involvement of psoriatic arthritis, and the trauma, T is the trauma, ligament tear, and E is the endocrinal abnormality, O is obesity and occupational. As it is in a major weight bearing joint, and if you are obese, maybe 100 plus 20 kilos, the major weight will come onto your the knee joints, and if you walk for longer duration, again weight knee joint, there is the more pressure and the load on the knee joints. So that's how these are the contemporary causes, and this is how human evolution is being either obesity, either the one strata of the people are moving into the obese towards obesity, and other strata of people are moving into like this. So this evolution is maybe after 50 years, the people of those generation will study this as a human evolution. And these again the contemporary cause of different kinds of arthritis, maybe joint. You may ask how here this directly your cervical joint is being involved. If you say, if you look at this in the angle that is in 0 degrees, you are watching your mobile, it means that something you have kept the 5 kg on your head, you're bearing or holding a 5 kg on your head. If in this you are watching your mobile at this 60 degrees, then it means that there is a 27 kgs on your head. Just imagine how much load will be on your neck joint. So naturally this to avoid much emphasis on the neck joint, those will be translated to, those emphasis will be flowed on to your knee joints, ultimately the weight bearing joints. So this is how the contemporary causes also be to ruled out. So, and this is how the sedentary lives in 1980, the people of the technology was very this thing, and the person was lean, and 2013 the person has become huge, whereas the technology has become so smart and so lean. So the technology making us fat, and whereas the gadgets are becoming so lean. Yeah, this is another important point. Considering this, I always emphasize all you doctors. Usually कोई भी clientele आते हैं हमारा, आके वो पेशेंट ओपीडी चेयर में बैठ जाता है, सर मुझे घुटने में दर्द हो रही है, वो ज्यादा से ज्यादा कोई लोग घुटने पकड़ के देख लेते हैं. बट आई रादर इंसिस्ट यू ऑल पीपल, इवन घुटने दर्द में भी आप पेशेंट को कम से कम ऑलमोस्ट एबो थाई तक आपको डायरेक्ट एग्जामिन करना ही पड़ेगा. So that you'll see what is there a knock knees or the bow legs. In the both the cases, there is chance of osteoarthritis. Then it is your job is to educate the clientele. It's not that you on had examined both the thing, and in the both the cases, the management is very difficult because you are not going to change this alignment. It takes almost an year, more than a year. So accordingly, you will plan that. While doing the panchakarma also, maybe you can do here in this case, rather doing an January seed, in this rather I more emphasize on the local dara. That is very, very important. So I emphasize you all. So कोई भी आप घुटने दर्द से आपको आएंगे, कम से कम उसे बोलना, कम से कम maybe सो पेशेंट से कहे वो कम से कम अपने आप तय से उसको जो भी उनके पैंट जो ऊपर तक खड़े उसे दोनों घुटने को लेटा के भी देखो, खड़ा होकर भी देखो, एंड यहाँ तक होकर वॉकिंग करवा के भी देखो. सो दिस दैट गिव्स एन दैट पर्टिकुलर एग्जामिनेशन गिव्स अ क्लू फॉर द राइट मैनेजमेंट. जैसे मैंने कह रहा हूँ, इन द बोथ द केसेस, इवन इन द knock knees and in the bow legs, both the cases, this particular January doesn't give much. I rather advise focus on the local dara and from this particular top to the lower level. So yes, every 3 months we do for almost 3-4 terms. Definitely the further bowing of legs will be minimized. And particularly this knock knees, I more emphasize. आजकल बच्चों में, कई बच्चों में, usually this boy knock knees is very common up to the age of 5 to 6 years. I could see particularly आज के डेट में बच्चों में ये जैसा 6 साल के बाद भी आप if you could see knock knees in the बच्चों में, इसका मतलब they are prone to the obese, already obese है. उसके बोन से मतलब उसके बोन इतना वजन नहीं आपको झेल नहीं पा रहा है, उतने knock knees ही बच्चों में obesity में I could see even 12 साल के बच्चों में भी मैं ये knock knees देख रहा हूँ. So this is very important, particularly while dealing with the children, just to examine the knock knees. And I could see the many cases and successfully managed. Usually is knock knees में, it's not the routine में मत न जाना. If at all बच्चों में knock knees के वजह से टांगों में दर्द हो रहा है, तो then you should more focus on. I strongly advise the कुमार कल्याण रस. And ज़्यादा से ज़्यादा एक गोली भी डेली भी दे देंगे तो आपको 3 महीने में तो mostly, and just go for vitamin D analysis. There is a depletion, you add that also, and definitely to the max, and within the 3 months I did many, almost 10 to 15 cases I did, and we can successfully manage this. And many parents come say even they don't observe this, but as a practitioner whenever बच्चों को आ जाता है, आप just have an examine this as a routine. Yeah, so coming to the next one, yeah, this is another one probably you people must have observed or not, but I do. While the reason why I am asking the patient to observe, examine the case in the lying posture, there are maybe you can see 1 in 100, maybe at times 1 in 1000, there is a leg length discrepancy in some patients. उनकी दोनों की थोड़ा हाइट डिफरेंस होती है. इन दोनों में नेचुरली देखो घुटने का अलाइनमेंट एक लेवल पे नहीं है, ये देखो. सो नेचुरली कुछ ना कुछ तो दर्द तो होना ही होना है. सो आप इसको आपने रूल आउट नहीं किया, एग्जामिन नहीं किया, देन आप लगातार दवाई देते जा रहे हो, अल्टीमेटली आप बदनाम होते रहोगे। पेशेंट कहते हैं आप इतना दवाई दे रहे हो सर, आप मुझे इलाज नहीं हो पा रहा, मेरा दर्द ठीक ही नहीं हो रहा है, आपने कुछ नहीं लेटा के ये भी कर रहे हो, बट यू आर नेवर एग्जामिन्ड। सो द रीजन, ये आपको खड़ा होके देखने में इतना नहीं पता चलता है, इट विल पॉसिबल ओनली व्हेन you ask the patient, you examine both the legs, length of both the legs, is there any leg length discrepancy? This is very important. Yeah, so yes, there are at times maybe rheumatoid arthritis affects only one single joint, that also be to ruled out, and particularly in the current case we are discussing only degenerative case. And the rama and reuma is a word meaning flux. So it was based on the concept that disease of moist nature with morbid discharge and fluid. So the word reuma indirectly denotes the guna of the ama. So there is a similarity of that. Yeah, coming to the other cases, there are clientele comes to you with the locked knee. Locked knee मतलब बिल्कुल वो bend भी नहीं कर पा रहा है, वो सीधा भी नहीं कर पा. They are called as a locked knees. That is also one of the reason. And there are two types of locked knees. The two locked knee where really knee joint gets, maybe we call as sandhi vishlesha, that is complete fusion of the joint. He could not move front and just वो सीधा चलते रहता है. A pseudo, आजकल कई cases आते हैं, pseudo locked knee occurs when make it difficult to move the knee joint. So in this particular in the case, we need an immediate, if it is, yes, but most of the cases locked knees में pain complaint very less. बस उनके कंप्लेंट यही होती है, सर मैं मोड़ नहीं पा रहा हूँ, चलने में दिक्कत हो रही है, अदरवाइज इज मूविंग. सो इट इज समथिंग यू कांट एक्सपेक्ट दैट आप पेशेंट को ऐसे मत करना चलो मैं 3 महीने में ठीक करता हूँ. सो ऐसे जब ज्यादा थोड़ा बड़े बड़े क्लेम करना थोड़ा ठीक नहीं है, इट टेक्स टाइम. So that is very important. And coming to the knee buckling and trick knee. So probably आपका भी कई patients कहा होगा सर आप चलते चलते मुझे घुटने में लचक आती है. So what is this लचक? That is knee buckling and trick knee. So that is bend out of shape. अचानक ये bend हो जाती है जैसे इमेज में दिखाया. So condition where your knee suddenly buckles beneath you, this means that your knee loses the ability to support your weight and gives. So usually knee buckling में लचक होने का मतलब ये है your muscles are getting fatigued easily. So the reason they could not support your knee. So इसलिए लचक आती है. It's not that अब knee लचक आने का मतलब आप ये मत सोचना knee में ही दर्द है, घुटने में ही दर्द है. Maybe you must be having some degree of degeneration, or but it's not that. But knee buckling, you are supposed to so the muscles or tendons which actually supporting your knee joint, you should look for that. And agantuja karana maybe sprain or the strain or the tear. So sprain is something, you see a tear in the ligament, whereas the strain is something tear in the muscle. So that is very important. The muscle or the tendon, and knee tear is an injury to one of the ligaments or muscles or layer of the cord that supports the stabilize the knee. So if any stray accident or maybe चलते किसमें लग गया, so any of possibility sprain, strain and the tear. This may be the transient, थोड़ा सा हल्का लग गया, थोड़ा सा आपको स्ट्रेच हुआ है, वो थोड़ा सा आप ऑयल लगा के थोड़ा लोकल लगाने से तो अल्टरनेटिव हॉट एंड कोल्ड ट्रीटमेंट करने से वो सेट हो जाते हैं. बट इफ इट persists, if there is a major blow or injury, then it leads to a chronic problem. And as I mentioned, the tear, this very common these days, particularly youngsters who walks for kilometers and runs for that, and they are the sports person. This is very common, that meniscal and ligament tear. And this meniscus functions as a shock absorber and helps, as we discussed in the previous, that is cartilage. There is an articular cartilage and the meniscal cartilage. This meniscus and the ligament tear is very common, and meniscus functions as a shock absorber and helps to distribute, whereas ACL tear and cruciate ligament is a band of tissue that it gives a structural support for the knee during twisting and intense activities. How can you say that if there is a strain in the joint? This is very important. Pain, especially when you're twisting or rotating your knee, then just you have to suspect that there is a possibility of either ligament or the meniscal tear. So there are two completely different structures we see. And usually the moment you say anybody is now coming to our knee joint, to us, usually we suspect that Sandhivata and Sandhigata Vata. These are the common symptoms which are documented in our Shastra, that is Sandhishula joint pain, maybe Shota joint swelling, feeling of touch, air filled bladder, Vata Purna Druti Sparsha, Sandhigraham, restricted movement of the joints, Akunchana Prasarana Vedana, pain during extension and flexion of the hand. Don't think that you see all 5 in one patient only. Yes, maybe with the 3, or maybe 1 to these 3, or maybe 1 to these 3, or 4, or any of 4, or any of 3, or maybe all 5. So that is very important. It's not that it is mentioned 5 means we are supposed to see all 5 symptoms in one patient. That should not be. Yeah. So how do you, if any patient comes, usually we analyze what exactly, how do you pursue? There are different ways of approaching the case from Ayurveda perspective. Everybody has their own way of doing. And usually the moment you say Sandhyari Kapasthana, that is Shleshaka Sthana, whereas as we are saying it is Sandhivata, as the site is the Kapasthana, whereas your mention is a Vataroga. Vata is Agantaka dosha, but particularly in the Sandhi. So, and there is a possibility of Vatakshya. If there is a Vatakshya, there is a chance of Shleshma Vruddhi that causes Sandhi Vishlesha, that is complete fusion. Shlesha Halingane. Vishlesha, that is complete fusion, that is complete Halingan, that is fusion of the joint. Whereas Vata Vruddhi causes Shleshmakshya, that is Sandhi Shedila, that is entire loss of synovial joint capsule and synovial joint. And this is a Madhyama Roga Marga that is not easily treatable with Kruchra Sadhya. And we may call it Astivas Rotos. If you look at this, there is Radhya Asti, that is called osteophyte formation, Sandhigata Vata and Asti Vidya. And Majjavas Rotomulam, we got Asti and Sandhi. So Vata Jananatmaja Vyadhi, you mentioned Janu Beda and Janu Vishwa. There are different aspects. So we'll see, we'll select such an therapies and the formulation, all the possible ways will hit the case. It's not that we have to look at from only one perspective. So while we understand the disease, explore all the possible ways to approach that particular disease. You select that formulations, you do such a kind, you plan such a kind of therapies that you target that particular condition from all the possible ways, so you will not leave any chance of that. So that leads to the better patient outcome. So yeah, so coming to the orthopedic practice, how we do this particular in day-to-day practice, not only Ayurveda, and this is very common in Ayurveda also. So Ayurvedic diagnosis, Ayurvedic treatment, that is straightforward. And second one is modern diagnosis and Ayurvedic. The patient directly says, sir, so I've been diagnosed with the grade 4 osteoarthritis of the knee joint. So you know that is so and so condition, and you do your treatment based on the modern diagnosis. And considering third one is Ayurvedic diagnosis and modern treatment. Yes, there is a severe condition, though we are diagnosed whatever it may be, Amvata or Sandhivata, what may be. If it is a severe pain condition, we take the aid of the modern medicine, that is Ayurvedic diagnosis and modern treatment. Whereas coming to the directly modern diagnosis, there are the people who did graduation and they are doing the whole of modern medicine, that is modern diagnosis. Yes, all different levels of practice, 1, 2, 3, 4 levels of practice. Which were proposed in way back in 1959 by Udupa committee. So this is very common in this particular orthopedic practice. So it is ultimately up to you to go by which way. So in the interest of the patient. Yeah. So if you come from the modern perspective, usually any clientele comes to that. So there is a pharmacological management. Usually, if the pain, the oral analgesics, NSAIDs, and others. And nutrition supplement, glucosamine, chondroitin sulfate, and the calcium supplementation. Usually we give topical agents and other emerging agents. The moment I say the calcium supplementation in most of the knee osteoarthritic cases, so I maybe at times I feel whether are we really, and usually what happens, we are the practitioner. If the similar kind of patient coming almost 10-15 cases, and almost 15 patients are having a knee osteoarthritis, and their orthopedist prescribes a calcium. And हमें लगते 15 पेशेंट आ रहे सर मैं ऐसी ऑस्टियोआर्थराइटिस थे, मुझे डॉक्टर ने कैल्शियम लिखा हुआ है। एक पेशेंट से आपने सुना, फिर अगले पेशेंट भी उससे भी सुना, तीसरा पेशेंट सुना, चौथा पेशेंट, लगते 15 पेशेंट सुन के आपको माइंड में ये फीड हो जाती है ये जो ऑस्टियोआर्थराइटिस हो तो इसमें कैल्शियम लिखना चाहिए। तो आफ्टर दैट यू स्टार्ट राइटिंग प्रिस्क्राइबिंग द कैल्शियम आल्सो। बट कैल्शियम हम सोचते हैं जो ऑस्टियोआर्थराइटिस में जो अस्थि वृद्धि हो रही है, व्हाट इज द अस्थि वृद्धि, द एक्स्ट्रा बोनी ग्रोथ स्पर्ट्स, दे आर कॉल्ड ऑस्टियोफाइट्स। जब ऑलरेडी अस्थि वृद्धि हो रही है, यू आर गिविंग समथिंग कैल्शियम सप्लीमेंटेशन। आई डोंट नो वेदर इट इज थियोरेटिकली जस्टिफाइज दैट our taking the allopathic principle, applying into Ayurveda and giving that. So these, you all are the practitioners, whether to do in a way or not. But in my practice, usually I never go do that. So yes, I do, but in very rare cases, that is something which is different. So, and topical agents and other emerging agents. Yeah. After that, if the patient could not respond, natural intra-articular injections. So corticosteroids, visco supplements, blood-derived products, they do intra-articular injection. So the severe pain, they administer corticosteroid into the joint, and there is visco supplement, there is a hyaluronic acid injection. Hope you remember this hyaluronic acid we read in this is one of the ingredient or the composition of your synovial fluid, which is being produced by the synovial membrane. So, as because of the lack of the deficiency of this hyaluronic acid, whatever it may be, so this synovial fluid gets dries up. So the reason they do visco supplement, but it's costly affair, and it gives, the efficacy will be only to the maximum 6 months, and every 6 months, once you start this hyaluronic acid, then that has to be repeated, hyaluronic acid every 6 months. And ये बड़े मुश्किल होती है कि मैंने एक दो पेशेंट को भी किया हूँ जो hyaluronic acid 3-4 इंजेक्शन लेके वो महंगा भी पड़ता है, वो नहीं ले पाता, हर 3 महीने, पहले शुरुआत में हर 6 महीने में होता है, उसके बाद 5 महीने में खत्म हो जाता है उसके का असर, फिर उसके बाद वो हमारे पास बनते हैं, उस केस को हम हैंडल करना एंड टू ब्रिंग इट टू द नॉर्मल, इट इज रियली डिफिकल्ट टास्क। रादर पेशेंट हाइलुरोनिक एसिड एक भी ना डोज लिए हो तो वो डायरेक्ट हमारे पास आएगा, तो उसको करना बड़े इजी है, बट वंस इफ इज बीइंग इंजेक्टेड इट हाइलुरोनिक एसिड, दैट बिकम्स वेरी डिफिकल्ट. And blood derived products that are platelet rich plasma, so these are the intra-articular inject, they directly inject into the, considering the cases and the severity of the different kind. So and again I'll take this discuss and hyaluronic acid in the further slides. Yeah, so after that, once it's failed the intra-articular injection, then the आजकल जैसे मैंने बताया in the previous slide, the knee replacement, the knee arthroplasty. It is a surgical procedure to replace the weight-bearing surface of the knee joint. As I mentioned, weight-bearing surface, that is the cartilage of the knee joint, to relieve the pain and disability. Procedure involves cutting away damaged bone and cartilage from your thigh bone, shin bone, and kneecap, replacing it with an artificial joint prosthesis made of metal alloys, high-grade plastics, and the polymers, so that you don't feel the pain. But आजकल लोग इतना जल्दी हो गए, जब इंश्योरेंस में मिल रहा है, हमारे जेब से कोई पैसा नहीं जा रहा, मेरे थोड़ी जा रहे हैं, वो फ्री में आ रहे, जाके हम करवा लेते, करवा के आ ही जाता है, कोई दर्द नहीं होता है if you start. But I am sure that in a 5 to 10 years again he starts getting pain at maybe in the ankle joint, or maybe in the hip joint, because the point is the जैसा पहले ये knee replacement से पहले बंदा, the fellow used to get the pain in the knee joint, अभी तो पेन तो गए नहीं, but you could not sense the pain, as because the pain feeling surfaces are being replaced with the metals, so that doesn't have any pain sensing capacity. So but the pain somewhere it will relocate it to your either maybe hip joint, or maybe your ankle joint, or maybe into your low back. So that's how the next, maybe down the line 5 to 10 years. Then coming to the Ayurvedic management strategy, everybody has their own way of management, doing the things. So always in my practice, I more emphasize doing one is immediate goal, short-term goal, and the long-term goal. The immediate goal is symptom modifying therapeutics. Symptom is usually, in most of the cases, the pain is a major symptom, and that has to be addressed, because patient आपके पास किसी है, सर मुझे दर्द के ठीक करो, जो होगा देख लेते आगे, पहले तो दर्द तो ठीक करो. So that is what the immediate goal. Second one is structure modifying therapeutics, that is a short-term goal. Third one is the disease modifying therapeutics, that is the long-term goal. So yes, it is the strategy you have to plan in that way. So you have to educate the patient that, so patient should not be in such a that, so I'll become perfectly all right by over that 3 times. Many clientele comes to me and treatment karte patient ko, and patient, particularly in the pain management, you need the proper counseling also. कई patient को मैं treatment करता हूँ, पहले दिन से ऐसे बड़े difficulty से आते हैं, हमने कुछ दवाई देते हैं, पंचकर्म जो भी करके 1-2 महीने के बाद patient after 3 months तो follow up के लिए आएंगे, जो कहते हैं, मैं पूछता हूँ usually हम अब आज का डेट में आपको ठीक कैसे है, मतलब आप कैसे लग रहा है, सर अभी भी रह गए. Then I counsel the patient, आप ये जो जवाब कह रहे हो ना, आपके अंदर पॉजिटिविटी नहीं है यार. जब आप पहले दिन आए थे तो almost you have a 10 points on the 10 point rating scale. आज के डेट में रेटिंग स्केल में 2 ही है आपका. So your positivity should be, सर बस मैं बहुत ठीक हूं सर, ये कहने में पॉजिटिव है, पेशेंट कह रहा है सर अभी भी रहेंगे, so that is a negative approach. So this has to be educated to the patient. Patient कहते हैं सर, कुछ लोग पेशेंट कहते हैं सर बस अभी भी 5% रह गए सर. Then my answer will be, मैं ये कहता हूँ अपने क्लाइंट, मे बी आई मे बी रॉन्ग और राइट, बट मैं कहता हूँ ये 5% तो रहेगा. पेशेंट कहते हैं सर ऐसा कैसे? द मोमेंट यू से ये 5% के भी आप कह रहे हो, देन यू विल बी बिहाइंड यू सर ये 5% नहीं हो रहा है, नहीं हो रहा है, नहीं हो रहा है. आप जैसे भी कह रहे 5% रहेगा, इसको कोई ज्यादा चिंता मत करो, अगले महीने पूछ ले, वो कोई दवा दर्दी नहीं है. बिकॉज द एक्सपेक्टेशन पेशेंट कीप्स ऑन यू, इट मेक्स द मोर एक्सपेक्टेशन. सो बेटर दैट 5% रहेगा, वो ज्यादा से ज्यादा पेन में जो साइकोलॉजिकल होती है और कुछ ना कुछ हो ही रहा है. ऐसा कैसे लगता है? इवन आई गो टू दैट एन एक्सटेंट, पेन इज अ साइन ऑफ लाइफ. Until unless you don't feel the pain, what is the proof that you are alive? So that is very important, particularly in the pain management. You have to properly counsel and educate the patient that so pain will goes in gradually. You should keep physically and mentally strong. That is very important. So the reason I emphasize more on the immediate goal, short-term goal, and the long-term goals. This is what the symptom modifying therapeutics hallmark of symptom of ONE is the pain, and acute condition prefer to give less and the simple drugs. That is very important. And underlying conditions ऐसे होगा hypertension, diabetes, hypothyroid, etc. to be addressed. And मेरा experience में ये कहता है कोई भी uncontrolled hypertension होता है, आप उसको दर्द को ठीक करने का दवाई दे रहे हो, उस केस में कोई भी दर्द का दवाई काम करते नहीं. I don't know why. Maybe the blood is flowing at the faster speed. I don't know why. बट ये मेरा ऑब्जर्वेशन है. द अनकंट्रोल्ड हाइपरटेंशन होंगे, आपको कोई दर्द का दवाई दे रहा होगा, उसमें उसको असर नहीं करेगा, प्रोवाइडेड आपको जब तक बीपी के कंट्रोल में नहीं लाओगे. So that is very important. Underlying conditions of hypertension these days, these three conditions are very common these days: blood pressure, that is hypertension, diabetes, and hypothyroid. These are to be taken care. So आप ये सोच रहे हो वो uncontrolled है, आप दवाई देते रहोगे, that will never be done. So in those cases, the new osteoarthritis will be secondary to the primary condition of these three primary conditions. And usually हल्दी शल्लक की पिपरी का combination which I usually prescribe. आजकल मार्केट में इन तीनों का कॉम्बिनेशन में कई दवाई आ रही है, मे बी FSSA की फूड कैटेगरी में भी है, तो so look at that. And ashwagandha churn you can give, and for the local application, if it is in a hot season, not in the cold season, that is kottam chukkadi churna with dhanya amla. That is an ideal lepa that we can. Otherwise, kashayas, more of readily prepared decoctions are more highly beneficial in, not readily, so freshly prepared decoctions are more highly beneficial in the pains, particularly the symptom modified therapies that we observe. And we can do some local abhyanga and potali veda also. This is another but immediate pain management. And in addition to that, also you people can do whatever you have your own choices. Just I'm giving an approach how to go ahead. And particularly in the pain management, you have to find out the foods, particularly the activities, those has to be nidana parvarjan highly essential, particularly in the immediate goal, that is symptom management, that is apatya, and milk products should be avoided, lemon and sour items, dry fruits and jaggeries, soya beans, salad and sprouts, nariyal ka pani, cool drinks, ice cream, besan, maida. Usually I avoid all for my clientele, and I am happy and my clientele are happy, my patients are happy. Maybe you have some more doubts, why this, why not that, and maybe people, so considering these days, अब मैंने अभी पहले एग्जांपल एक बताया, 15 पेशेंट आके हमें ये कह रहा है सर मुझे ऑर्थोपेडिशन नी ऑस्टियोआर्थराइटिस में कैल्शियम दिया, हमें कहीं ना कहीं हमारा माइंड में घुस जाती है, हमें पता ही नहीं है. So 16th पेशेंट से we start writing what do you say, कैल्शियम टू द नी ऑस्टियोआर्थराइटिस पेशेंट. सिमिलरली आल्सो कोई भी घुटने में कोई दिक्कत होगा, न्यूट्रिशनिस्ट ने किसी ने किसी बोला होगा आप ड्राई फ्रूट्स खाते रहो. हम 10 पेशेंट लगातार सुनते 11 माह में लगता है हमारा माइंड में घुस गया, हम 11th पेशेंट को हम भी स्टार्टेड सेइंग दैट ड्राई फ्रूट. द मोमेंट यू से दैट इज अ वाता प्रकोपा. So that has to be kept in mind. So coming to there are different group of herbs in Charaka 4th chapter. So those can also be taken into Angamarda Prashana, that is alleviates malaise and body ache. So these are the different formulations. Accordingly, you can use. Yes, there are the patient having so knee osteoarthritis. In addition, patient feels हर time मुझे body में so दर्द सा लगता है. We can choose this Angamarda Prashana. So whatever the medicines available in this, we can prepare as an afresh. It's not that you will get all the 10. Maybe if you get 2 or 3 or 10, 4 or whatever it may be. So that is very important. And there is another group of drugs, that is Shula Prashamana. So these are different herbs we can take into this, and Shula particularly, where there is a chul. And remember, if any pain in any part of the body, usually I have a habit of taking, so give some Shula Parashamana. Usually the moment you say Shula Parashamana, we more emphasize on the abdominal colic. But so yes, there are sayings also, every pain gets has its roots in the stomach or GI tract. So yes, it's true. So koi bhi dard hoga, may naturally I tend to give Shula Vajrini Vati in addition to that. So maybe आप कैसे भी समझ लो, जैसा modern science, they give any painkiller, they give antacid. They think that there is a painkiller, there is a chance of causing irritation. But if you give, and if the pain is severe, if you give more of high dose, 1 gram in the morning, afternoon, and lunch, then there is a definitely chance of getting gastric irritation. So that way also you'll get given a safe that you will add Shulavarjini. But even in other cases also where there is no gastric irritation, instead of giving only the whatever it may be the analgesics and Ayurvedic analgesic, if you add some Shulavarjini, what is similar kind of anything, but I'm happy with the Shula Vajrini, and your patient outcome will, I'm sure it will be definitely doubled. And coming to the next, this group of herbs, the 10 group Vedana Stapana. So Vedana Stapana is also Vedana Sambhutam Tam Nihatya Sharira Prakrutau Stapayati. Vedana is provided general feeling of sensation. So it relieves the pain sensation. Unusual, particularly unusual, without any reason, patient, particularly this Vedana Stapana, I more emphasize to give this Vedana Stapana in the females. So this, there are at times, particularly in the 40 to 50 age groups, around perimenopausal period, females complaints, idiopathic, unusual bodily pains, where I more emphasize. In addition, they also have the knee joint pain. So there, particularly Vedana Stapana, this Dashyamani is more highly beneficial. And coming to the Shotahara also, if you have a patient complains of joint swelling, so we can use, particularly mostly they are, Dashamulas are the major one in the Shotahara. And even I prefer to give Dashamula Kashayam plain, this Kwata Churna, particularly in the summers, I'll give Shita Kashayam. I'll ask the clientele to soak in the water over the night and have whole the day. It's not a single dose. So this is how, maybe you people have a different way of giving the things. I rather ask the 10 gram of Dashmola Kwata Churna in 1 liter of water, soak it over the night, and the next day just mix it and sieve it and put this 1 liter of water has to be consumed whole day from morning to before sunset. So in between with the food, other water can. Whereas in the winters, I'll ask the same, but it has to be boiled for almost 10 minutes in the next day morning, 10-15 minutes. Again, those has to put in a hot flask and has to be consumed. So instead of giving one dose, I rather insist more in a whole day. So I compared both the case. I'm happy with my clientele, the way I'm following. So it is up to you whether to go ahead. You may try out this way also. Yeah. So considering those and other practices and most potent top 10 herbs, I've introduced this Rujagna Dashaimani. I've introduced this Rujagna Dashaimani based on the classical literatures, contemporary evidences, and a clinical experience. I've grouped these 5 herbs. These definitely works. Maybe immediate goal in the long-term goal and short-term goal. The Ashwagandha, Ballataka, Eranda, Gugulu, Haridra, Nirgundi, Rasna, Rasona, Shellake, and Shunti, and other that they have a sustainable effect. It gives a sustainable benefit. Yeah. So coming to the structure modifying, as we are discussed in the symptom modifying, then coming to the structure modifying therapeutics. So I rather insist Gandhathailum is definitely, it's more of a long-term short-term strategy. It strengthens the joint capsule, and Trayodasham Gulu, it strengthens the joint supporting structure, that is muscles, ligaments, and the tendons, and Punarnavadi Gugulu, you can add where there is a swelling, and Aba Gugulu where there is a cartilage depletion, and Lakshada Gugulu where is the tears. So how to give these Gugulu, then I will discuss in the further slides. So, and coming to the Januvasti, as you know, this is a very popular that. So don't think that Januvasti se kya hota hai, bahut kuch hota hai. Not only the Januvasti, and I very widely practice, as you all practice Kativasti, Grihavasti. I also practice Urovasti and Hrudvasti and Nabhivasti. I widely practice this also. And don't underestimate that. Don't underestimate that these local oil pulling therapies are the no. I'm happy these oil pulling therapies are gives but provided you are supposed to choose in a right oil. It's not only the procedure. Maybe you can say, sir, मैंने इस केस में जानवस्ती किया हूं. It's not that. The question comes that by procedure, Janavasti will contribute only 50%. The remaining 50% will be the oil which you have selected for the Kativasti. It's not that, but always I suggest you people don't go for whatever it may be the Vasti, whatever, don't go for only one oil. Rather, you go for the combination of oils, 2 or 3. So that gives, considering the different origins. I always combine the 2 minimum and at times 3, and that is the way. And Ketaki Muladi Thailam and Likocha Thailam I usually prefer, and Gandha Thailam is also, and Gandha Thailam. And here I before Januvasti, I usually, maybe you people are practicing before Januvasti, I do local pottery, and this pottery is very popular, and this commercial pottery is being very popular by particularly this Kairali group. To the best of my knowledge, the Kairali is the group which they have introduced the commercial potteries, which are available online, and these days it has become so popular that people are getting the this commercial ready-made potteries, and they are doing this pottery at their DIY, that is do it yourself mode, these potteries. And that's how I thank to take this Kairali to take this our traditional the pottery to the commercial level. So, and this Janu, I prefer, because once before starting the Januvasti, we do local pottery, it increases the local circulation. After that, if you put the Januvasti, and there's a proper exchange of this thing, and that gives definitely in a better results rather directly doing the Januvasti. That is very important. I use usually Ketaki Murali Thailam, Likucha Thailam, Gandha Thailam, but though Gandha Thailam gets 10 ml, if the patient is comfortable enough, maybe you can add 1 or 2 or 20 ml into those, and the effect is something, you know, definitely the extra effect will get. And if it is then a tears, any ligament tear, then you are supposed to add Mahanara Thailam and Lakshadi Thailam and Murivan and Kapuradi. So I definitely advise Mahanara in the particularly in the tear cases. And question comes, अरे इससे क्या होता है? जैसा मैंने बताया last time, if there is in a case, usually in particularly what is the difference between Januvasti and Ekangadara? Ekangadara, you need a lot of oil. Maybe if you want to really do minimum 3 liters, 3 to 5 liters, if you want to really do in a continuity. If you take the less oil, there is less continuity of the doing the things. Whereas the Januvasti, it has maybe probably if your you know fiber Nivas Januvasti yantra is broader and more of a height, then it needs maybe half liter to 1 liter. I rather insist that there are people लोग ऐसी 150 ml से भी जानवस्ती कर लेते हैं, but I'm not pro to that. The point is the more the height of the oil while pouring in the Januvasti yantra, the deeper the effect. That's how it gives its a pressure. And how this particularly Januvasti and Ekangadara, where we have, if there is any, you know, as I've shown in the previous slides, that if there is an knock knees or the bow legs, there you have to modulate entire whole leg. So there Januvasti could not going to help much. So there it is better to have an Ekangadara on the both the legs, front and back and left hand. So all this. So how these particularly Januvasti, how it go लोग कहते हैं अरे इससे क्या होता है यार, तो पूरा तो हड्डी है. So as I mentioned, the joint capsule is not covering your kneecap. There is that weak point. We can use that. So regarding again, you have the cutaneous. There are the more cutaneous receptors on the particularly the knee joint and the particularly the front and the back. So there are the 4. One is the pressure receptors, another is the temperature receptors. So another is the pain receptor. So these all the receptors can be being modulated. And there are receptors which are present in the superficial layers, in the joint capsule, one is in deep layers. So accordingly, definitely it modulates the pain. So that's how it is very important to have an immense effect is by Januvasti and Ekangadara. Yeah. So coming to the leech therapy, yes, many people do, even I do leech therapy, particularly in the cases where, as I mentioned, hyaluronidase present in the saliva of leech stimulates hyaluronic acid present in the synovial fluid. ऐसा मुझे लगता है कहीं ना कहीं ये there are 2 cases. As I mentioned, if there is a fusion of the joint, that is solidification of synovial fluid. Where in other cases, if you feel if the hyaluronic जो liquid बन सकती है जो already fuse हो गया है, वहाँ आपको saliva leach करने के, if it releases hyaluronic into the circulation, then there is a possibility of hyaluronic, as in the modern science they inject hyaluronic acid into intraarticular injection. So where मुझे लगता है कहीं भी हो, so you it's not that सब में leech therapy करते जा रहे हैं, कुछ में आ रहे हैं, कुछ में improvement नहीं आ रही है. Maybe you must have observed this. So this is a right context where exactly leech therapies have a direct focused effect. So as the hyaluronic is present in the saliva, please stimulate hyaluronic acid sign present in the synovial fluid. Yeah, coming to the last, that is a long-term strategy, the disease modifying therapeutics. So anyhow, the first and foremost, as I mentioned, is the nidana person is highly important. We more panchatikta Google, it is highly effective in asti majja vikara. As we analyze the condition, is directly asti and majja are involved in this particular condition. And Mahayavaras Google with gold is also highly essential. And Virechana karma on weekly basis with Nimbamrita, particularly in obese cases. And you can do matravas with Bras and Davadi Thailam. These things which I am practicing. So at Kashaya Vasti with Gugulu, Tiktaka Kashayam, Chira and Sachara Thailam, you can choose other also in considering other all associated illnesses. So these are the important, particularly disease modifying therapy that you can do maybe every 3 months or every 6 months, so that down the line maybe in a year or 2 years, so the disease comes to a cease. Cease means stop. So yes, there are conditions we may not reverse those conditions completely back, but this particular condition is in a maybe gradually or fast progressive condition, or in some cases fast progression, in some cases so gradually it's somehow it is progressive condition. So if this progression is bring back to the stop condition, that is disease. So the disease modifying means it is bringing your disease progression to the stop, that is disease condition. So this is how important. As I mentioned, the Google, so in the structure modifying and disease modifying therapeutics, always in most of the cases, I don't give Google as such. So I ask my clientele at times Google to be dipped into the Gandha Thailam, or maybe the Google Tikta Gurutam, or maybe other associated, considering other conditions. So it has to be so. And जितना भी आप Google को formulation फलश्रुति पढ़ेंगे, आपको last में ये लिखा था गुरुता भांडा निदापये. So this Google has to be stored in a Google गुरुता भांडा निदापये, Grita smeared vessel. So these days it is very difficult to get those, and ultimately the very purpose of mentioning this is your Google should be soft and anxious. So that may not be possible, but not possible in the real situation. So I ask my patient to take the Google has to be dipped into either maybe Gandha Thailam or whatever it may Google, or maybe any suitable ghee. And while doing Januvasti, the question comes whether it is supposed to do only with the oil or not to be done. It's not only the oil. Even if you really want to do, we do vasa. If you look at I ask all you people, just refer the benefits of the vasa that we have forget. There are 4 chatusnehas, that is Taila, Gruta, Taila, Vasa, Majja, and we have forgot this Vasa and Majja because maybe the availability is very difficult. And I'll ask you to just refer the benefits of and Vasa, Majja, and you see they are directly beneficial in these clinical conditions. If you could able to, if you are practicing very nearby forest areas, just be careful that just getting those, the vasa is, it's something, majja is highly recommended. Gurta means you naturally, cow's ghee is gurta, oil means that tel da whatever, vasa and majja is, it's ox majja. Bhel ka majja jo marrow hoti hai wo highly beneficial hai, whereas vasa is the forest variety pig ka jo hoti hai uski jo vasa hoti hai, it is highly. So even in the western countries those people will use, if you get those into the Indian market and you do with that January, it is highly beneficial. So that is very important. You can ask your patient to get the procure from the you will get this. So that are more highly beneficial. You can explore those things. So that is very important. So coming to the, as I mentioned, Nimbamrita, the Eranda Thailam or Google Tikta Grutam, more or less they have the same formulation, and Google is also one of the ingredient in this. So this is Sandhya Asti Majja Gata. So these particular Sandhi Asti Majja Vikaro mein either Gugulitikta Grutam and Nimbamrita, they are highly beneficial. And ultimate essence of Ayurveda, which I have introduced an acronym, that is DIET, D-I-E-T, DIET. What is this DI? Why it has to be called as dietary intervention instead of diet? If you say plain diet, which nourishes your body, maybe it nourishes your disease also. But dietary intervention means ahara patya means which is patya conducive to patya to your body, and whereas it is apatya to your disease. Dietary intervention, for example, I'll tell you, takra is dietary intervention in arshas, arsho atisara grahane. That means takra gives nourishment to your body. At the same time, it is also beneficial in the curing your disease. So that's what the true meaning of the dietary intervention. Second one is exercise and activities of daily living. So जो बिहार जो होती है, जो आपको precipitating factors हो, those has to be avoided, and do mild and resting phase and mild activities. And the treatment part comes at the end. So this acronym this is an acronym introduced by myself, and it is supposed to be, I'm going to trademark this. So you are free to use this, but you are supposed to acknowledge the source from my name. So this is an ultimate whole essence of Ayurveda for all the diseases. Yeah. So coming to the last year, the World Arthritis, that is 12th October. 12th October, the theme of the don't delay, connect to today. So I look this today as connect today, that is to daily Ayurveda and yoga. That's how you have to connect today, means connect to Ayurveda and yoga. So that's how the final theme of this lecture. And thank you all. And Ayurvedo Rakshati Rakshitaha. So that means he who protects Ayurveda shall in turn be protected by means. That means it's not that you protect the Ayurveda. Protection of Ayurveda means Ayurveda 5000 साल उस time से अभी तक कैसे आया हुआ है. So somebody is using that. So using Ayurveda, adopting Ayurveda means in turn you are protecting Ayurveda. So that means you adopt Ayurveda in your day-to-day life. In turn, you are being protected by it. That is Ayurveda Rakshati Rakshata. And thank you, one and all.
Thank you, sir. Thank you very much for such a wonderful insight of the subject on the topic osteoarthritis. We are delighted to have you here. Really, we got so much to know about the topic, which we lost in our clinical practice. Specifically, you made us realize that pain is the sign of life. You said that 5% of pain will always be there. Patient will never say that yes, I'm completely okay. Every time he is going to complain, still there is pain. That 5% pain, that concept, pain is sign of life. It was really wonderful, sir. The anatomy, the structural knowledge of the joint, how the joint is made, it was very well explained. And the concept of Shulvajani Vati, actually we were doing the practice of prescribing Shulvajani Vati in the management of pain of soft tissues organ, like internal organs. But you had enlightened us that it is definitely it is beneficial even for any sort of pain, be it the pain of bones or joints or any kind of neuromuscular pain or whatsoever the pain. So that concept is really, it was very beneficial for us, sir. I thank on behalf of all the doctors present over here, all the colleagues, doctors, the management, everyone. On their behalf, I take on this opportunity to thank you for such a wonderful and knowledgeable session. Thank you, sir.
Thank you.
Thank you, Doctor. Thank you so much, Doctor, for this wonderful session. I believe all the attendees have taken a lot of insights and a lot of learnings from this presentation. And I would like to thank all the attendees. I would request all the attendees to stay just for 10 minutes. We will just wrap up the webinar in just a brief time, within 10 minutes.
We have some
So
questions
now,
also.
We would like to take up some questions. So Doctor, please take up the questions and answers, please.
Sir, though, I mean, we have got more than 80 questions in the Q&A section.
Tremendous, very good response from all the people.
But we will not be in the position to let's try to take. I mean, I have prepared some summarized all the questions and prepared some common questions. One very common question is that, like, what could be the Ayurvedic approach for the replacement of glucosamine? Like वो देते हैं कुछ cartilage को repair करने के लिए, तो उसको though we are like you said that majja and vasa is very wonderful, but still we would like
या
some insights, sir.
आपका क्वेश्चन को तो नेचुरली, बट उसका आंसर कहीं ना कहीं मैंने दे भी दिया। क्यों? तो मैंने बोला ही नहीं, जो जैसा कैल्शियम डॉक्टर्स लिखने लग गए, हम भी स्टार्टेड प्रिस्क्राइबिंग कैल्शियम, वो लोग ग्लूकोसामाइन लिखने लग गए, हम भी स्टार्टेड ग्लूकोसामाइन हमारा दवाई में कहाँ है। बट आई एम श्योर, आई एम रिक्वेस्टिंग ऑल द पार्टिसिपेंट, जस्ट गो थ्रू द वसा एंड मज्जा and you will enjoy the beauty of those the benefits of and vasa majja। आपको वो मिले, आप थोड़ा सा देख लेना, फॉरेस्ट वाला से कोई वो जगह जो उस एक्ट में ना जाए, फॉरेस्ट डाइवर्सिटी एक्ट में ना जाए, तो आपको पता है क्या, मैं आई एम डूइंग द ईस्टर्न पार्ट ऑफ द डेली प्रैक्टिसिंग। आजकल आपको तो पता ही है, जो पहलवान लोग होते हैं, वो घुटने में दर्द होते हैं, सारे वहां पहुंच जाते हैं, हमसे ज्यादा बड़े भीड़ लगते हैं। वो पता है वो लोग क्या यूज करते हैं, वैसा ही यूज करते हैं लोग। जो पट्टी, जो छोटा पट्टी लगाते हैं, वो लोग यूज करते हैं, वैसे ही है। वो हमारा जो है वो यूज करने लग गए, हम भूल गए। सो आप ये देख लीजिए, इट्स नॉट दैट गोइंग इन ए दैट वे, सो इट इज गोइंग इनटू दैट, गिविंग ए कैल्शियम सप्लीमेंटेशन, गिविंग ए ग्लूकोसामाइन, इट्स नॉट गोइंग टू सॉल्व द पर्पस। बट आजकल ऐसे क्लाइंटेल हमारे पास आते हैं, सर मैं ग्लूकोसामाइन ले रहा हूं, आयुर्वेद में कोई ग्लूकोसामाइन है क्या, ऐसे पूछते हैं, तब देना ही पड़ता है। अल्टीमेटली पेशेंट इज सो स्पेसिफिक दैट मुझे ग्लूकोसामाइन का सब्स्टिट्यूट आयुर्वेद में बताइए। तो अल्टीमेटली यही आता है, जैसे बोलने वाला आबा गुगलू है, समझ गए, लाक्षादि गुगलू है। सो डेफिनेटली, बट दैट हैज टू बी, आई मेंशन्ड, आइदर इट विद द डिप्ड इन ऑयल, आइदर इट डिप्ड इन घी। बट क्वेश्चन पता है क्या आता है, क्वेश्चन ये कहता है, सर ये मुझसे नहीं होगा, सर ये लगाओ, वो डिप करो, मुझसे नहीं होगा। पता है अब क्या करते, तब हम, आई विल आस्क गुगलू, वन गुगलू एंड वन द गंध तैलम कैप्सूल टू बी swallowed at once. So कम से कम something is better than nothing.
Perfect, sir.
Yeah.
Very true, sir. So another question from a colleague, like how to confirm and diagnose that the knee osteoarthritis is avarnajanya or kshayajanya samprapti?
ये थोड़ा सा डिफिकल्ट क्वेश्चन है। द पॉइंट इज आवर्णजन्य एंड धातुक्षयजन्य, फाइन, दैट्स व्हाट द क्वेश्चन।
Right, sir.
आई विल टेल यू वन थिंग, जैसे मैं डिस्क्रिप्शन आयुर्वेद को समझते वक्त मैं डिस्क्रिप्शन दिया, संधि स्थान इज कफा, संधि स्थान इज कफा, एंड दोष वाता, we say it is sandhi vata, but sandhi is the स्थान of श्लेष्मा, but the vata is coming into, lodging into your this thing. It comes that whether it is avarana or dhatukshayajanya, there are two aspects. I'll tell you one thing. These two aspects, there is a possibility they can exist separately, or these two aspects, they can, in chronicity, this avarana will become dhatuksha. I'll tell you one thing. If imagine there is an amavata condition, maybe this is how I perceive the things. If there is an amavata, if amavata patient of having an origin of almost 10 to 15 years, can we expect ama even after 15 years? No, it will become all mostly of vataro, because all deviation of the joints. If there is an initial stages of ama, there is a chance of ama being occluded, maybe occludes vata, or that maybe leads to the avarna. So it depends whether it is ama associated or not. It is on clinical grounds. Maybe I don't see that. Can we really differentiate both that? Whether it really gives impact on the outcome or the treatment management. So that usually in the both the cases हम ऐसी प्लानिंग करते हैं, यार हम कुछ समझ में नहीं आ रहा है, ऐसी प्लानिंग करो, वो आवरण को भी टैकल कर ले, धातुजन्य को भी टैकल कर ले. For example, I am giving Gugulu Tikta Grutam. It has a dual effect. Got it? सो दैट्स हाउ हम कभी कभी हम बुद्धि लगाने की कोशिश करते हैं, हमारी बुद्धि से बाहर होती है. इट्स नॉट दैट वी डू एवरीथिंग. अरे ऐसे समझने चाहिए तो आयुर्वेद पूरा समझ ले, तो हम तो भगवान ही बन जाते, लोग हम फोटो लगा देते. ओपीडी में आते पेशेंट, तो पेशेंट कहते हैं सर ये बीमारी पूरी तरह, अरे पूरी तरह ठीक हो गई तो आप मेरा सारे तो मुझे बाबा बना देंगे सारे लोग. ऐसे थोड़ा होता है, कुछ ना कुछ तो भगवान भी है यार ऊपर, जितना हमसे होता है हम पूरा कोशिश करते हैं. सो दिस इज व्हाट माय आंसर.
Very true, sir. Very true. Okay. So can we take another question, sir, with your permission?
नो प्रॉब्लम.
Okay. So see, another one colleague is asking, what is the importance and restriction of Sneha Kalpine Thaulya person with degenerative OA?
Yeah, we can, but there we see the Tiktavan, no? It's not the Brumana. For example, you see in Medo Roga, he can give even Gugulu Tikta Gruta 1 spoon morning and 1 spoon evening. It doesn't makes you to put on weight. It further it makes to lose the weight. So definitely वो तो चाहिए, and I strongly prescribe. तो जो भी आप गुगलू देंगे वो आपको गुगलू तिक्तम घृतम में डिप करके ही देना, particularly obese patient. In my practice, for all the obese patient, I give गुगलू तिक्तम घृतम. If not, Google निम्बा अमृता एरंडम. If you feel that अब गुगलू से कुछ होगा, बट एरंड तो है ही है, कफूर व्याधि तुम आप एरंड तेल वो भी दे सकते हैं, बट वो थोड़ा टेस्ट के लिए दिक्कत होती है. You can choose the capsule. निम्बा अमृता एरंडम कैप्सूल भी मिलता है मार्केट में. That also you can choose.
Yes, sir.
We can give तिक्तक घृतम and एरंड तेलम comfortable you can give obese patients.
Ji. Sir, can I ask one more question?
No problem.
Another one colleague is asking, like mithya yoga eating and drinking in standing position. Like there is a, even in villages also, in rural public also, they say that don't eat or drink in standing position. Does it have any effect on the knees?
ये थोड़ा सा एग्जैक्टली तो एज सच वी डोंट हैव एनी स्टडी, बट मैं ऐसा प्रेज्यूम करता हूं जो भी है. सो एनीथिंग, द जॉइंट इज समथिंग विच इज एन ए लिक्विड टिश्यू, धातु, तो संधि श्लेष्म, फाइन. सो एंड अगेन उदकवा स्रोतो मूलम is your throat.
Yes.
I feel there is a functional linkage. I feel there is a, so rather मैं joint के लिए नहीं कहता हूँ. Yesterday I was delivering one lecture. Why the people are being asked to drink the water only in the sitting posture, not in the static posture? But my direct answer is, मैं ये कहता हूँ सिटिंग पोस्चर में इसलिए पीना है, आप स्टैंडिंग पोस्चर में पीने से आपकी डाइजेस्टिव ट्रैक्ट एंड योर रेस्पिरेटर बोथ आर इन ओपन पोस्चर. There is a spilling of, there is a chance of spilling of water into your respiratory tract. If at all sitting posture में पिएंगे, naturally the diaphragm will be up. Diaphragm will be up. There is a closure of your respiratory tract when compared to your digestive tract. So आपको water spilling respiratory tract में होने के sitting position में कम chance होते हैं. Fine. When it coming to the joint, this is in a Vedic belief. As such, we don't have any established studies. So nothing is wrong in obeying that. Nothing is wrong. So for example, so maybe somewhere we say in a squatting posture is more highly advisable. But फिर भी हम वेस्टर्न टॉयलेट में जा रहा है तो कहीं बोले ही नहीं. So it is something, it should be in a balanced mode. if आप पेशेंट को जबरदस्ती कहोगे स्कैटिंग में, तो अगले दिन से आपको आना बंद हो जाएंगे, हमारा दुकान बंद हो जाएगा. So it should be in a balanced way that हम पेशेंट को बड़े ज्यादा टाइट भी नहीं कर सकते, एट द सेम टाइम लूज भी नहीं कर सकते. पूरा लूज करेंगे पेशेंट अगले दिन आके कहते हैं सर आपने कुछ बताया नहीं. ये भी होता है यार, ये है, आप ध्यान रखना थोड़ा सा, जितना अवॉइड कर सके उतना अवॉइड करो तो अच्छा है. ज्यादा टाइट करोगे अगले दिन से दूसरा डॉक्टर को ढूंढ लेगा, तो ये भी ठीक नहीं. So it should be the science and the client should be in a balanced mode.
Very well explained, sir. One more question is there.
Please.
Ki there is a confusion among doctors, including myself. Like, should we advise exercise or not in case of OA? कुछ कहते हैं कि एक्सरसाइज करना चाहिए, कुछ कहते हैं एक्सरसाइज नहीं करना चाहिए, रेस्ट ज्यादा करो. So what should be the actual logic in that?
Yeah. So ultimately इसमें दो पॉइंट आते हैं. एक्सरसाइज है, अभी अगेन द सीवियरिटी कितने हैं, दैट इज अ मैटर. अल्टीमेटली जो भी एक्सरसाइज करे, एक होती है जॉइंट के ऊपर लोड डाल के एक्सरसाइज करोगे. आपको ऑलरेडी नी ऑस्टियोआर्थराइटिस है, इमेजिन आपने नी कैप पहना, आप 100 किलो उठा रहे हो, कैन इमेजिन यू विल बी फाइन? नो. सो अल्टीमेटली जो एक्सरसाइज करे वो नी के ऊपर लोड कम पड़े, ये भी तो कर सकते हैं। आप समझ लो, आप खड़ा होकर एक्सरसाइज कर रहे हो, खड़ा होने में बॉडी का वजन तो नी जॉइंट तो उठाना ही पड़ेगा, ऐसी कुछ दिक्कत हो रही है, आप फिर खड़ा होकर आप एक्सरसाइज कर रहे हो, वो डबल लोड पड़ेगा। तो नी का लोड हटा के जो एक्सरसाइज करना, दैट यू कैन डू।
Okay, okay. And one more question I'll put, sir, because there are
Please.
so many questions. Ki, if there is if there is not a provision of जानू बस्ती, ऐसा कोई फैसिलिटी नहीं है, ओपीडी ट्रीटमेंट, ओपीडी फैसिलिटी है, अगर हम जानू बस्ती नहीं कर सकते हैं, whether in that case that पिचू, जानू पिचू, will it be fine, sir?
या फाइन। सो जानू पीछे अभी पेशेंट को भी कुछ नहीं होता, कोई हमने व्हाट यू से जो आजकल व्हाट्सएप कंसल्टेशन हो गए, थोड़ी आप उसे बुलाओगे, वो कहीं दूसरे जगह बैठा, हम यहाँ बैठे हो, क्या करोगे? घर में वो करना है तो नेचुरली जानू पीछे बोलते कुछ ना कुछ, यार कुछ ऑयल डालो। अब कभी कभी हम ये भी बोलते पीछू के जॉइंट के ऊपर लूज से वो कर लो, जो घास क्लॉथ होती है, तेल में डिप करो, यू हैव टू बी रोल्ड डाउन टू द मिड थाई टू द मिड काफ एंड यू पेन वो जो नी कैप पहनो। इससे क्या होता है, चद्दर में भी नहीं लेगा। पेशेंट को ज्यादा दिक्कत दर्द से नहीं, ज्यादा नहीं होते, सर ये तेल लगाओगे मेरे चद्दर खराब होती है, तो वो भी तो ध्यान रखना पड़ेगा ना, उसे डेली चद्दर कहाँ से लाते रहेगा पेशेंट। तो कहते वो लगाओ भाई, ऊपर से वो नी कैप पहनो, तो पूरा 12 घंटा रहेगा। हाँ ठीक है सर, कोई दिक्कत नहीं हो रही, ठीक है भाई चलना, तो क्या करोगे। एंड रिमेंबर, मैं आगे सारे प्रैक्टिशनर्स कहता हूँ, जरा कोई नया नया प्रैक्टिस में आता है ना, बड़े यार मैं सब कुछ ठीक कर दूंगा, ये कर दूंगा, वो कर दूंगा, ऐसे होता है। अभी मुझे करते करते ऑलमोस्ट मोर देन 2 डिकेड्स। पेशेंट के माइंड में मॉडर्न साइंस में मॉडर्न डॉक्टर्स ने ऐसी ट्यूनिंग कर रखा हुआ है, ये ठीक नहीं होते रहेंगे, चलते रहेंगे। रिमेंबर, मे बी कुछ लोगों को ये थोड़े फैक्ट हजम होते नहीं होते हैं, आई एम वेरी प्रैक्टिकल। सो जैसा सोसाइटी का ट्रेंड चलता है मैं वो देखता हूँ। पेशेंट को ये पहले ही पता होती है ये ठीक होने वाला नहीं है। पेशेंट आयुर्वेदिक डॉक्टर पास आ गया, आप कह रहे हो मैं ठीक कर दूंगा, ऐसे शब्द आप बोलोगे तो समझ लो आप हो गया आपका काम, आपका जीना मुश्किल कर देगा पेशेंट। सो पेशेंट का माइंड में ऑलरेडी है तो ठीक होना ही नहीं है। क्यों? वो मॉडर्न ऑर्थोपेडिशियन ऐसे ट्यूनिंग कर रखा हुआ है, अरे ये ठीक होने वाला नहीं है, दवाई खाते रहो। समझ गए? ये हमने नहीं किया, इट इज बीन डन बाय द ऑर्थोपेडिशियंस, व्हाटएवर द फिजिशियंस कंसर्न। वो हमारे पास आते, हम भी पहले शुरू में ऐसे हम पूरा करेंगे, दवाई की जरूरत कम पड़े आपको। समझ गए? ऐसी करना, आप आते ये मत बोलना आप लोग ये बिल्कुल ठीक हो जाए। समझ लो आपका जीना मुश्किल हो जाएंगे, प्रैक्टिस करना, इससे बदनाम ज्यादा हो जाओगे। क्यों? जो पेशेंट ठीक होते हैं वो कहने कम होते हैं, 10 पेशेंट ठीक होंगे, उसमें से 1 ही 2 पेशेंट आपको माउथ टू माउथ कन्वर्सेशन, पर्टिकुलरली आयुर्वेद में। एलोपैथी में 10 पेशेंट ठीक होगा तो 10 वो डंका बजाते। आयुर्वेद में 10 ठीक होंगे तो 2 ही पेशेंट आपको माउथ टू माउथ कन्वर्स करेगा। बट जो 8 ठीक नहीं होते ना, वो पक्का आपका माउथ टू माउथ कन्वर्स है, डॉक्टर ने ऐसे कह रहे तो ठीक ही नहीं हुआ। तो बी सेफ एंड बी स्मार्ट इनफ, डोंट मेक द थिंग्स हाइप। इफ द पेशेंट उस फीलिंग में है तो वो कह रहे हैं बिल्कुल सही है, हम आपको दवाई की जरूरत कम पड़ेंगे, धीरे धीरे आपको दवाई की जरूरत नहीं पड़ेगा। तो दिस इज अ वेरी स्मार्ट एंड द सेफ आंसर।
Very well said, sir. And I can see like we are live on YouTube, and we have a lot of general public also watching over there. So as Dr. Satya sir had already said earlier, that don't follow anything by yourself. Always consult an physician, an Ayurvedic physician who is nearest to you, or you can approach us and get consulted and get proper advice. अपने आप से एक्सपेरिमेंट्स नहीं करना है। एंड रियली सर, इट वाज वेरी
डॉक्टर सचिन, 2 क्वेश्चन मैंने देखा, उसके मैं 2 जवाब देता हूँ।
हाँ जी सर, प्लीज।
somebody asked विजया कैसे होता है घुटने में दर्द में। विजया, that is cannabis. So you, as you all know, there is an ECS system in the body. ECS मतलब ये नहीं है जो बैंक के ECS करते, इलेक्ट्रॉनिक क्लियरेंस सिस्टम, वो नहीं है। There is endocannabinoid system. बट ECS बड़े अच्छे हैं, जैसे ECS तुरंत हो जाती है, इससे भी तुरंत हो जाती है इफेक्ट। So definitely ECS has, there are n number of evidences on PubMed. ECS has a remarkable effect in knee joint pains, but it modulates. But otherwise, as I mentioned, there are 3 level strategy: immediate strategy, short term goal, and long term goal. These has to be kept in mind. Somebody asked Agni Karma. Yes, Agni Karma is highly beneficial. Agni Karma is highly beneficial. Again, it is immediate strategy. That is pain management. But again, we have short-term goals, short-term strategy, and long-term strategy. And somebody mentioning in that is Mahasneyam. Yes, Mahasneyam includes Vasa and Majja also. But if you get pure Vasa and exclusive Majja, that is. But I'm insisting you all just refer your books. Just refer that what is the benefits of Vasa and Majja. And this is something which is really we forgot that. Thank you one and all, and I wish all the best, and I wish you all flourish in your day-to-day practice. Thank you.
Thank you so much, sir. Thank you on behalf of everyone, the Kairali group, the Kairali team, and whole of the Ayurveda fraternity and doctors present over here. I thank you for such a wonderful session. Thank you so much, sir. Over to you, Rishabh, please.
Yeah, thank you, Dr. Sachin, and thank you, Dr. Satya, for such an insightful presentation. And I'm so grateful for all your patience, support, and a wonderful presentation. Dr. Sachin, thank you so much for moderating the event. Attendees, doctors, everyone, now I would like to introduce Mr. Puneet Endle, who will just give you a brief about Kairali Ayurvedic products, about our company, what all products we manufacture, everything he will explain you. So it is a short presentation which he will talk about. Just stay back for 5 minutes. It's a brief presentation. So Puneet, you can start the presentation now.
Good evening, everyone. And let me just start my session by thanking you all for being such a kind audience. And Dr. Satya has been such a great orator and explaining each and every question and giving attention to detail to every topic which he has prepared. So let me just give you a brief about Kairali Ayurvedic products. So Kairali Ayurvedic products is a 111-year-old company wherein we manufacture more than 323 SKUs, including oils, arishta savas, churnam, grit, kashayam, gulika, vati, and our patent medicines. We do manufacture products in Kairali brand, as well as we do manufacture products in third-party manufacturing also. And nowadays, a lot of doctors have turned themselves into third-party manufacturers, wherein they give us their requirements and we help them formulate the products. They give us the basic formulation. Our R&D can help you develop the formula, do the clinical trials, and then launch the product. We can help you in getting the licenses of those products also for proprietary. So yes, we have proprietary organics, we have herbal infusions, we have our Kairali Ayurvedic proprietary medicines, traditional Ayurveda, and a couple of books written by our director ma'am, which is the books. So this is our proprietary organics. We have the facial oils, we have the face pack, hair wash, and a body scrub. These are the organic range. This is the product that Dr. Satya was talking about. This is a DIY kit for the arthritis and joint pain patients. So this kit comes in two categories, 55 ml and 110 ml, wherein we provide a single potli and a double potli with 110 ml oil. We have other oil for fractures, healing. We have body muscular oils, detoxification oils. This is our complete series. Then we have our herbal infusions. We have 3 types of herbal infusions for detoxification, rejuvenation, and for immunity. So Arogya is our immunity, Yuvan is our de-stress, and Tahira is our detoxification herbal infusions. Then we have our care cosmetic series. We have 6 ranges of shampoos, shower gel, body lotion, hair conditioner, 3 types of soaps that we manufacture right now. We have 17 proprietary medicines that we have in tonic capsule form. We have a pain balm called Sparab, very effective for pain as well as cold. So we have a complete range. It's a complete portfolio of medicines for an holistic. For example, if anybody wants to treat their patients on different dimensions, so we have the complete range available. We'll be sharing the price list in the Telegram group and the WhatsApp group, and my team is sharing the numbers. You can WhatsApp directly and we can give you our complete range of products. This is the traditional Ayurveda. We have 20 churnams, 12 types of Ayurveda gulikas, kashayams, arishtasavas, lehams, 44 types of thylams, grithams, rasayanams in complete range. We have 2 books. One is the diet book for the Ayurveda cookery. Then we have herbal massage book for the people who want to do massages at home. This also is a DIY kit for people who can't afford or who can't go to the massage centers. These are some of the awards and accreditations that our group has earned. The product list and the price list will be shared with you on the Telegram, WhatsApp, social media circles. You will be getting phone calls and follow-up calls from our sales team. And yes, so the complete range, what I was trying to tell you is, in case you have any formulation, you want to manufacture products, get your own brand name registered and want the products in your own brand name, that is also possible. You can take exactly Kairali products. We offer good discounts to all the doctors, and they are very helpful in your own practices. And please use Kairali products, support Kairali Ayurvedic products, and help us also grow and take Ayurveda to a lot newer level, because a lot of the entire world is now inclined towards Ayurveda. And I thank you all. Over to Rishabh. In case,
thank you so much. Thank you so much, Puneet. And now, before ending the webinar, I want to announce the winners for this, who asked the best question. So we announced the winners. So Dr. Venkatesh is the winner. Dr. Reshma Begum is the winner. Dr. Mandeep Kaur. And they all 3 will get a gift voucher from Kairali Ayurvedic Retreat. They win the voucher for 3 nights, 4 days at a retreat. It's a fully paid trip, which includes the meals, the therapies, and the stay arrangements. So the vouchers will be shared within 48 to 72 hours with all the winners. And I really thank you so much for you all to join this webinar, to attend this webinar and take some insightful things. I would like to now end this webinar. If you have any questions, you all can contact us. The numbers have been shared by our team with you all. You can contact Mr. Puneet. You can contact Mr. Dr. Sachin, me, Rishabh Gupta, and we will be happy to answer all your questions. Vouchers will be shared with everyone within 48 to 72 hours. So vouchers can be redeemed, and certificates will be shared in the next 5 to 6 business days. Everything will be shared within 5 to 6 business days. So nothing to worry about. And certificates will only be shared by who have attended the webinar. And certificates will be shared to the group. So you all can download the certificates from there. And if any questions, feel free to message us through Telegram, WhatsApp, email, call, whichever works for you. We will be happy to answer all your questions. Thank you so much. Thank you, Puneet. Thank you, Dr. Satya. Thank you, Dr. Sachin. I would like to thank all my backend team, Ritu, Vikas, Himanshu, everyone, to be supportive, to help us run the webinar successfully. Thank you so much. I would like to end the webinar now. Thank you. Have a safe day. Have a nice day.
Thank you, Rishabh.
We will be announcing again to you all another set of webinar. And don't worry, we will be keeping these kind of webinars every month. We will keep you posted about it. Thank you so much.